5 seconds to get settled. Excellencies, distinguished guests, ladies and gentlemen, good morning. Good morning. Yeah, cool. Thank you. It's bright and early here in the capital city of Abuja. His Excellency Dr. Bernard Doro, Honorable Minister, Humanitarian Affairs and Poverty Reduction. Good morning, Doctor. Welcome to you, sir. Please, a round of applause for the Honorable Minister. Mr. Michael O'Sullivan, Head of the World Bank Africa Gender Innovation Lab. Good morning and welcome again. Dr. Lire Esado, Lead Economist, Social Policy, World Bank. Good morning. And I love that broad smile, your broad smile, welcoming us to another day. Fantastic. The speakers and panelists for today's session, members of the diplomatic corps here present, commissioners of women affairs in the various states here present, directors of the Humanitarian Affairs and Poverty Reduction Ministry, as well as the Ministries of Budget and Economic Planning, the Ministry of Livestock Development, the Ministry of Agriculture and Food Security, also here present, and other officials of government, ministries, departments, and agencies, welcome. Senior officials of the World Bank here present, Amy Geist, Program Officer, World Bank Africa Gender Innovation Lab, the Nigeria Governors Forum Secretariat, the Nigeria for Women Project, the Livestock Development Project, development partners here present, the Gates Foundation, the staff of the World Bank, the organizing team of this Evidence and Policy Forum. Please, a round of applause for yourselves. Leaders across government, private sector, and civil society organizations, the academia, researchers here present, gentlemen of the press, distinguished guests and participants, ladies and gentlemen, good morning once again and welcome back. This is the second day of the Evidence and Policy Forum on Women, Jobs, and Markets, Unlocking Inclusive Economic Opportunities in Nigeria. I am Nancy Ilonaji. It hasn't changed overnight yet. I'm still a broadcast journalist. That's my 24/7 job. I'm the anchor and executive producer of Moneyline with Nancy on AIT, and it's my pleasure to continue this important journey with you this second day. Excellencies, Honorable Minister, distinguished guests, ladies and gentlemen, yesterday, Honorable Minister, let me just recap a bit for you. Yesterday, we did something significant. We moved beyond assumptions yesterday and grounded our conversations on evidence. Of course, it's the Evidence and Policy Forum. We heard clearly yesterday that gender gaps in earnings, productivity, and access to capital are not abstract. They are measurable. They are life. It's something we can count. And the cost of inaction is not theoretical. It's economic, and perhaps most importantly, the solutions already exist. We heard all that yesterday from both ministers that were here present, the Minister of Budget and Economic Planning, Senator Atiku Bagudu, as well as the Minister of Women Affairs and Social Development, Hajia Iman Sulaiman Ibrahim. From agriculture to the finance sessions, we talked about livelihoods, we also talked about enterprise, and we saw what works. And we heard directly, even from both ministers, affirming that this is not just a social conversation anymore. It is a matter of national economic priority. So today we'll move forward, and we're glad to have you join us. We are also glad that perhaps on this second day we would move from clarity to commitment. If our commitment was a bit half yesterday, I hope we'll get the glass full today after today's event, especially from evidence to execution of the solutions that work. You know, because in Nigeria, I hear a lot of people in my line of work, they say, oh, Nigeria, we are not starved of ideas. We are not starved of, we know what to do, we don't lack ideas. But I'm sure that what this forum is doing would do today is that how do we make good ideas move faster? Because if we all know what to do, but we are not doing it, or we are not making it move as fast as possible. So, Honorable Minister, in a nutshell, that's actually what transpired yesterday. So, distinguished ladies and gentlemen, at this point, there's no need for too much talking. We'll just go straight into it. It is my honor to invite a man whose work sits at the intersection now of vulnerability, resilience, and opportunity. He has over 2 decades of multidisciplinary experience spanning clinical, pharmaceutical practice, pharmaceutical leadership also, law and strategic management across both the UK and Nigeria. He brings a uniquely integrated perspective to public service, combining technical expertise with community impact. His role is central to strengthening social protection systems, addressing vulnerability, and ensuring that no one is left behind in Nigeria's development journey, especially women. Please join me in welcoming the Honorable Minister of Humanitarian Affairs and Poverty Reduction, Dr. Bernard Doro, for his keynote address.
Thank you very much. You may take your seat. Distinguished representatives of the World Bank Group, esteemed colleagues, partners, and stakeholders, ladies and gentlemen, good morning. Good morning. Good to know we are all here. It is my honor to address this important forum on women, jobs, and markets, unlocking inclusive economic opportunities in Nigeria. I commend the World Bank Group for convening this timely dialogue and for its continued partnership with Nigeria. Nigeria today faces a defining moment. It faces a challenging time. Nearly 63% of our population lives in poverty, but multidimensional poverty and also monetary poverty. As a matter of fact, the recent World Bank report put us at 63% also. And since evidence shows that multidimensional poverty is usually higher than income poverty, we may as well conclude that our multidimensional poverty may be higher. This is a reality that affects economic productivity, social cohesion, and the future of our nation. This challenge is even more pronounced for women, who continue to face structural barriers to jobs, finance, and market access. Yet, the evidence is clear. When women are empowered economically, households thrive, children are better educated, and communities become more resilient. That is why our approach is deliberate and evidence-driven. Through the National Social Safety Net architecture, implemented in partnership with the World Bank Group, Nigeria has reached over 9 million poor and vulnerable households. representing more than 41 million individuals, with 58% of beneficiaries being women. This is not just a social program, it is a national investment in human capital and economic inclusion. We have learned critical lessons from this experience. That cash transfer works, not only for consumption support, but as a foundation for investment in livelihoods. Digital and transparent systems matter, ensuring dignity, efficiency, and accountability. Targeting women directly transforms households, improving outcomes in health, education, economic decision-making. As a matter of fact, I've been interacting directly with beneficiaries of our HOPE cash transfer. And I've had amazing stories from women. I met a lady who received a grant, benefited from the $75,000 that was given to her household. And that was last Friday in Kwara State. Her testimony moved me because when the money came, her daughter was sent away from school at the time because she couldn't pay her school fees. Upon receiving that money, she was able to use it for her daughter to go back to school. That just shows what women can do when they have access to economic empowerment. Building on this, the Federal Ministry of Humanitarian Affairs and Poverty Reduction is driving a bold reforms. The One Humanitarian, One Poverty Response Systems to unify data, align interventions, and ensure that every intervention, from social protection to economic empowerment, leads to measurable exits from poverty, especially for women and other vulnerable groups. Our vision is clear. Move from fragmented interventions to integrated systems. Transition beneficiaries from vulnerability to economic participation. Ensure women are accurately identified and reached through unified national registries. Scale women-centered economic inclusion pathways, linking social protection to jobs, skills, finance, and markets. Distinguished ladies and gentlemen, the task is not just to generate evidence, but to scale what works. This requires stronger partnerships, innovative financing, and deeper private sector engagement, particularly in expanding opportunities for women across value chains. Let me therefore emphasize 3 priority areas. Scale financing for women's economic empowerment aligned with national systems. To integrate social protection with jobs and markets, ensuring pathways to sustainability. Strengthen data and delivery systems so that no woman is left behind. In conclusion, empowering women is not a sectoral agenda. It is Nigeria's development strategy. When women succeed, Nigeria succeeds. I assure you of the federal government's unwavering commitment to building an inclusive economy where every Nigerian woman has the opportunity to thrive. Thank you very much.
Thank you very much, Honorable Minister, for that keynote address. You said a lot of things that hit my nerve here. And I'm hoping I'll have a chance to ask a question during the fireside. Yes, Dr. Lira is giving me. Because you gave the analogy of the woman that you met in Kwara, 75,000, paying her words or her child's school fees. And what came to my mind is the strategy that Brazil uses called Bolsa Familia, whereby they give money or cash to women, but they tie that to outcomes in terms of if I give you this money, you ensure that your child goes to school and all of that. But I have a question for you, which I will ask during the fireside chat. And I will ask it because I'm the anchor of this event, MC, and I'm a broadcaster, so I ask questions for a living. I have it here already. I won't tell you so that you will not give me preconceived answers. But thank you very much, Honorable Minister, for at least bringing up some things that we need to think about. Because for poverty, women bear the brunt more. And just like you stated, if a woman is economically empowered, her household lives better, generally because perhaps we are more emotional, we have the more human side, we are thinking of how our children will fare better. But there was something that was said yesterday, Honorable Minister, and I also want you to think about it, and that's why I'm bringing it up. That even as women, if we are economically active and we have business success, it does not guarantee that we are decision makers. It was one of the things that was found here as evidence. And since yesterday, I haven't recovered from it. Because even as a woman, I'm talking of myself now, I've been in this profession now for about 25 years, talking money for close to 20 years. And I know I'm economically empowered. I know at least I'm better than most women. So me being a successful broadcaster or journalist, it doesn't make me a decision maker. So these are things we need to begin to look at. And I think the evidence is right. Because even when you look at corporate organizations, the boardrooms and all of that, how many women do you see there playing? How many female billionaires do you have? Even in the world, not just about Nigeria. How many women are decision makers in politics? So that's something we need to think about. I haven't come out of that shock. Thank you. I haven't come out of that shock since yesterday. And I hope I'm able to wake up from that. But that means that there's still a lot more to be done. And I'm sure that some of those ideas will be tested in the next item on the agenda, which is the fireside chat conversation. I'll be bringing up the Honorable Minister again. So please welcome back the Honorable Minister as he takes the podium. And welcome again Dr. Lira Sado, Lead Economic Social Policy at the World Bank, to drive this fireside chat.
Okay, perfect. I was just chatting before we started with the gender director from Nigeria's Governors Forum, Hawa. I told her my experience walking around, going places in Abuja. One example was when she said the spouses club of the governors. No, but I have seen Hawaii, in some of the places I go to, like there's a police wives club, army wives club, navy wives club. Why aren't the women as governors, as police officers, as Navy officers? If that's the case, why do we have to use that very restrictive expression, wives club? So I think how I managed to correct at the Nigeria Governors Forum, and we hope there will be women governors soon. Don't we want to have that? Doesn't everybody agree? Yeah. As a powerful decision makers. Huh? So maybe, Nancy, I will start with the question you raised. Huh? Women as decision makers. You said financially, economically, you are quite empowered. And yesterday, presentation IO made also showed that the economic conditions of women have improved, but still they are not decision makers. So how can we, I hope I'm trying to paraphrase your question for HM Doro. Thanks, HM, to be here with us. Maybe that, Nancy, if you want to elaborate better your question, I think it's a very good one to get started with. But the point that came up yesterday as well is women, they may be economically okay, financially okay, but when it comes to decision making, the support we provide to them is not making that huge difference. So how can we correct that situation, HM Doro? Huh? Let's start with that question, if you don't mind.
Thank you so much. Again, it's a sad reality of our country and most part of the world. And there's this saying that power is not given, it is taken. So, yes, this may be the sad reality, but at the same time, and I know there are cultural contexts to this, but at the same time, I believe that women will need to fight for this. Because when you find yourself in a situation whereby, because of culture, you've always been the decision maker. You don't just wake up one day unless there is a complete reorientation to give it up. So I believe that forum like this starts a conversation to perhaps get men to start thinking differently. It triggers something also in women, that they can assume leadership. The women that I have in my life, work, relationship-wise, and what have you, have been good decision makers. And I don't see any reason why they cannot take decision, and especially when they're empowered. So the society will need to continue to push this agenda, but overall, I'll encourage women to take charge. Thank you.
Thanks, HM. I think that's a very powerful message for women. I also come from a family dominated by women. Like I have two daughters and son and my wife. So I feel that power and that genuine decision making, which is in the interest of the family. Huh? It's not my wife, when she makes decision, always in her mind is the family at heart. And I think this happens in every other family. Nationally, you could see where there are women are leading. We see a lot of gains, a lot of empowerment, not just for women, but also for men. So I think we appreciate the fact that the point you made that that we need to empower women, and that women also need to take charge. And in order to help women empowerment, I think the next question I have for you is, you mentioned multidimensional poverty in Nigeria is about 63. I think that figure came before the latest monetary poverty numbers, which showed about the same number, 61. What that show is that there is a great need, a high magnitude of need to support Nigerian families, given the level of poverty, vulnerability in the society. And then when you look at the investments through the social protection or other means that we see Nigeria, put it in comparison with other countries in similar economic stage, with similar needs, we think Nigeria does not invest as much as it should, given the size of its economy. It's one of the largest economies in Africa, if not the largest, given that there is a growing need for support. So the question I have for you, HM, is how do you envision Nigeria building fiscal space to increase domestic financing of these critical programs, for spending on humanitarian response, on social protection, and poverty reduction in general, which is under the purview of your ministry, and especially when it comes to targeting women? How can we envision Nigeria making the necessary investment? We don't say it's spending, it's investment on women. How do you envision Nigeria providing comparable type of investment? Right now, our figures, globally comparable figures, show that Nigeria spends about 0.14% of GDP on comparable programs versus over 1% for sub-Saharan Africa, or about 1.5% globally. How do we help Nigeria get to the level of at least its peers, its sub-Saharan African countries? And that's a question we have, and it's not a new question for you, HM. We've been raising this quite often with you. What is your ministry doing for us to get Nigeria to the level of its peers?
Thank you so much. I assumed office November last year, and I've spent the last 4 to 5 months reform-minded. My emphasis has been in reforming the social protection architecture in the country. And I came up with a flagship that I call One Humanitarian, One Poverty Response System. And there are different anchors to this mouthful title. One of it is the financing architecture, the financing framework, because we need to pay for humanitarian intervention, more so that there's a humanitarian reset. And we all know that the global financing of humanitarian or social protection initiatives is shrinking. We all know that money is not coming in, but our people are still suffering due to crises will require humanitarian intervention. Due to poverty, require systems that work. So, if Nigeria must take over, if Nigeria must take leadership, then there's need to invest. And so, within my new reform program, I have come up with this whole idea to better finance interventions by having what I call a humanitarian and poverty trust fund. In that, we're looking for government commitment, tangible commitment, because I believe that when you take leadership, there's a responsibility also that goes with it. And so government will inject a huge percentage into the humanitarian trust fund. And at the same time, we're looking for continuous partnership with our development partners. Yes, I know that the funds are shrinking. They're not coming in as it should be, but I believe that we have good partners that will not just abandon Nigeria. So in that financing architecture, we are looking forward to development partners continue to help us in that regard. I'm also leveraging within that framework private financing. We started doing quite a lot. Recently, I was in Lagos engaging with private sector so that we begin to turn the narrative and get them involved. Because what I tell the private sector is investing in humanitarian intervention or poverty reduction response is not just a charity. Because when you have a huge percentage, and by the way, the figure you quoted is from the 2022 multi-dimensional index. So when you have a huge percentage of your population inactive economically because of poverty, then you're losing business. There would be skill shortage. So when the private sector invests into humanitarian intervention, into poverty reduction, what they're doing is moving these individuals in the non-productive sector into productive sector. That means more people to be able to hire because they have developed skills. And that also means more workers so that means more clients, that will buy their product, and also more people to be able to hire. So our humanitarian and poverty trust fund will have a blended financing model from government, from development partners, and also from the private sector.
Thank you so much, HM. I want to build on your keynote, and also you just mentioned about the one humanitarian, one poverty response system. I think it's one of the most ambitious attempts led by you and by your ministry to move away from fragmented and possibly less effective social programs to a coherent, data-driven, pathway-oriented. It's not from humanitarian response to poverty reduction and ultimately self-reliance. I would like us to spend a little bit more of your time on just unpacking that. I know that you have described the motivation, the importance of that very well, but I want you spend a little bit time on the core principles. How can we move families, individuals from humanitarian support to less poverty and ultimately to self-reliance? What does it take? What are the pathways for families to ultimately become their own income generators and self-reliant? What does it take, HM? Huh?
Thank you so much. How long have you got?
We have 2 minutes.
I mean, if I start talking on this, it takes the whole day. Again, in our reform-mindedness, we did a bit of scoping exercise when we took over and realized that Nigeria has several interventions from different quarters. The government is doing a lot in different areas for social protection, humanitarian intervention. The development partners are doing theirs, private sector doing theirs, NGOs, INGOs, and what have you. Now, a lot of money is going into the system, but there's lack of coordination. And so we discovered that there's a lot of working in silos, a lot of duplication of efforts, multiple registries, for example. Every program that is being designed with a set of registries. And so we're spending so much money in inefficiencies and what have you. So we thought, how do we solve this problem? And so the one humanitarian, one poverty response system is an attempt to provide humanitarian intervention and poverty response in a coordinated way. We unify the process and provide it with everyone dipping into a national strategy to be able to deliver effectively and to remove duplication. Because when you begin to do this in silos, you give room for leakages, wastage, and what have you. So, one humanitarian, one response system brings this into a coordinated way. So that is that in summary. So, the core principle behind that is to say, you know what, for long, we've divided humanitarian intervention and poverty response or development. So, but what I'm saying under the one response system is that when we deliver humanitarian intervention, for example, cash transfers to targeted beneficiary. Now, rather than just leave them with a one-off support, we stabilize them, but we've already got them. We can then track them through a poverty exit pathway. So we have a framework where we can immediately we stabilize this individual. We then do a bit of need assessment and find out how we can skill them up. Skilling them up, then how can we support them with money, access to finance? How can we provide some sort of business coaching? And how can we help them to be able to establish themselves and then be self-reliant? So we do this through a number of ways. For example, we unify our registries. So we have the National Social Register, for example, for targeting, and we move individuals from there to the National Beneficiary Registers. We moved from there to National Exit Registers and then onto Growth Registers so that we don't lose these individuals at all. So even if people were resilient and independent and their business is growing, there could still be shocks in the system that can affect their businesses or what have you. So we want to keep them in the growth register so that when shocks come, we find them where they are within that framework and then push them back onto growth. So there's quite a number of things, and key to it also, and I'm summarizing this because it's a very big concept, okay? So that concept is anchored on a few things. So we're looking at the entire governance architecture. That is where we bring everybody together. We're looking at data. We need to harmonize our data. I should be able to sit in my office as the coordinating minister of social programs in interventions in this country to know exactly what is happening in every part of the country. I should know what intervention people are doing. And that is possible through a harmonized data initiative. And also, the registries, which I've just explained, we unify the registries, and then we're looking at the financing architecture. But one thing I want to emphasize here is the poverty exit pathway, which is one of the anchors of the one humanitarian, one poverty response system. And within the poverty exit, we want to ensure a framework that helps people with a clear entry point and a clear exit point. So, in summary, let me leave it there. Otherwise, I'll continue talking.
Yeah. Thank you so much. I think this is, as I said, very powerful, very ambitious initiative. We wish you all the success. We all, by providing evidence, analyzing data, sharing international best practices, everybody is be supporting you. As Nancy said, this is one key way of moving from evidence to action, and ultimately from action to impact on the lives and livelihoods of families. And it will send a powerful message and lesson for other countries in the continent and beyond. So we are looking forward to supporting you in this effort. And just as we move, I don't know how much time I have. Nancy, I have two more. Let me build my next question on what this forum has done over the last 2 days. Yesterday, there was a presentation by many researchers on what works, what doesn't work, how we can move from evidence to action, from action to impact. And related to that, and what the empirical research is showing is that while social safety net programs such as cash transfer, thank you, HM, for making a powerful case for importance of cash transfer. It's not just to reduce poverty or from the Quora example, it shows that that money was used to send a family member to school. That money is being used to open businesses. But the problem, the evidence is showing that so women or anyone receiving this kind of support needs something more than cash, beyond cash. They need livelihood support beyond cash, some complementary interventions such as savings, training. So that injection of cash by itself may not lead to sustainable way of overcoming poverty and ensuring lasting change. For that, I think let me use one example from our NASP gender assessment recently completed. It shows that women may open business using the support they receive from this, but they're staying small, very family-oriented, small, that does not lead to more productive, more scalable businesses, unlike for men in other interventions. So it still seems they may open a business, they may run a business, but social norms and other factors constrain women, their mobility, their access to market, and so that their business tends to stay home-based, small and micro. How can we help women to grow their business, scale it up, make it more productive, generate more jobs? So I think that's a challenge the evidence is showing for women. And any ideas, any guidance you have for that, so that women can spring out of that home-based micro small businesses and then be able to scale and grow their business beyond that.
Okay, from the data I shared earlier on, even from the household prosperity, we'll see that we targeted more women. And it is not just by coincidence, it's deliberate. First of all, this is a huge demography. And at the same time, the most vulnerable. Now, I'll still emphasize on the plan that the federal government has, which is My Poverty Exit Pathway. That is one strong platform or framework that can be used to be able to help vulnerable in terms of, and once that is achieved, you ensure that money is provided, access to finance is provided, support in terms of mentoring, coaching is provided. And once that is done, a lot of women will be able to take on that opportunity to be able to engage in businesses that will help them to be self-reliant. And as we have already established, you do that to more women, then the household is helped, generally. So support is needed for women to transition and be socially mobile.
Thanks so much, HM. I think you responded all the questions I had very well, and I think I'm sure the audience took note, and then we can think of how we can move from this stage to the next stage, helping women economy empowerment in Nigeria and beyond. So, but with that, I would like to open up. I'm sure there are huge researchers in the audience with some insightful questions for you. I don't know how much time I have left, Nancy. 10 minutes. So we have 10 minutes. I think we should be able to take a few questions. And anyone questions pertinent to the discussion we are having here? I think let's open it up, and we want to hear, especially the commissioners from the states, colleagues from outside Abuja, and anyone actually, maybe any icebreakers before we can be selective. Yeah.
Let me now break the ice, because it seems nobody is asking a question. Perhaps the minister has succinctly explained. Minister, I said earlier that I had a question I wrote down, but somehow you tried to answer it, because what the question was or is around how to translate that vulnerability to economically active people or women. Because if you say that example of the Kwara woman, 75K has been given to her, there will be no 75K again, as it were, isn't it? No 75K anymore. I heard you clearly, you talked about a stabilizer and a poverty exit initiative. Is that ongoing now? That's what I want to ask. So it's not a matter of, okay, government will do, there's a policy, the macroeconomy, we are thinking this. What exactly is happening right now? What is ongoing now? Because that woman that 75K was given to, she won't have 75K again. If she does not have that 75K, perhaps in the next few months, if she's not economically active, her child will be back home. So I want to know about that. And for the rate of poverty that we have, at the last NDU, the report, 63% of Nigerians are poor. Of course, we've established here that many of them are even women. You know, there's also child poverty involved. How do you transit these millions of people, you know, into being economically active? Because I'm really wondering about that. And you mentioned earlier, this question is double-barreled, since no one is asking. So let me ask the question on behalf of all of us. You mentioned earlier, when you were talking, you said women should fight. Power is not given. Power is taken. How do we fight? How do we take charge? How? Because it's not a matter of talking. How do we fight? How do we take charge? We have that subtle power at home, as it were. How do we translate that subtle power? We are trying to translate it. They are saying no. But how do we take charge? How do we, how do we take power? HM, sorry, double barrel, but it's for you to answer.
Thank you so much. The reason why we are trying to solve a problem is because we've identified one. You identify a problem, and you don't just jump into it. You need a system that works. And my job is to ensure that I achieve the result that Mr. President has set, to get millions out of poverty. And so I wouldn't have done this in the past 4 or 5 months. But I believe that building on what was done before, we can then be able to leverage that and achieve results. So I have identified a problem. I'm working at a solution. And while working on that solution, it doesn't mean that we are not offering any form of assistance. So, for example, currently, we're designing a new program. And in designing this new program, we are capturing things that we have identified that have not been implemented in a way that gives us measurable results. And so, if you ask me, do I have a program that takes 63% of Nigerians out of poverty today? I'll say no. But am I designing one? I'll tell you yes. While I'm designing one, I'm looking at shocks in the system. And if I identify shocks, then I design a quick win program that help to resolve the shock. So that program currently is, recently I think was it about 3-4 weeks ago, we subjected our new program through a thorough technical session that lasted for 4 days. And so the structures currently are being built. And we want to believe that within the next few months, we will have an effective program that will help Nigerians and deliver people from vulnerability to self-reliance. So help us with your advocacy, because that will require funding. It will require a lot of things. On an average, I think it takes something around 350 to about 1,500 to deliver. Is it household now? Or I think World Bank, you can help me with that. Whether it's the household or individual to deliver either an individual. I cannot give you that clearly, but it takes about $350 to about 1,500 household, right? To be able to deliver a poverty exit program to a household. So if you multiply that by 100,000, by 1 million. So by the way, the figures we're giving put us at about 140,000 Nigerians that are multidimensionally poor. So it's a lot of work. So we multiply, say, an average of 1,500, by whatever number, and it gives you a huge financial investment. So we are working at this, and it was going to be incremental, but we believe that they say a journey of 1,000 miles starts with a step. So we're taking the baby steps, and we believe that once we do that consistently, we'll be able to achieve results. So the issue of power, I believe women have soft powers, and just the way you use that at home, I'm sure that can be used elsewhere. You are very, very powerful. And I think it's just to believe in the soft power that you have. I know that the one I have at home have got a lot of soft powers. And when they take a decision, they know how to convince me to go by that decision. As a matter of fact, I think probably they control the whole situation. But behind the scene, it's like an unseen hand. So just make that hand visible, because you're already taking powerful decision. And for the men here, let us also engage in advocacy. I believe that when women are in charge, you get results. And let us create that space for women to be in charge, because it's good for society, it's good for family. That's my belief. Thank you very much.
Thank you. Okay. Nancy, that's a very satisfying answer. So we want our mothers, sisters, daughters to take charge, to be in front, not just have a soft power and staying behind. So we want, because we see the results on the ground. When women are in charge, everybody is benefiting, regardless of gender. So we want the full power, that nearly half of the population, we don't want to leave them just with the soft power or staying behind, but to be fully in front and leading and taking charge. And we have to help, because that's in our own interest. It benefits everyone, more so than maybe the other side. Anyway, with that, we want to open up for a few more questions. I hope there are some. You guys, you hear the HM, I think he's making very powerful responses. So we want to hear more questions from the audience so that we take advantage of his presence here. Go ahead.
Yeah, good morning, everyone. My name is Bountiful. I'm an entrepreneur in agriculture. Mine is really not a question. It's more of a suggestion to the Honorable Minister. I think that we need to build more structured approach to moving women into being economically empowered. I feel that there must be some intention behind bringing women to the fore. We might adopt some sort of like a quota system across private sector, across ministries that allows for high-performing women to be at lead roles instead of make way for their male counterparts. I think that's my position.
So can we take a few more? Thank you so much. HM, you want to react? Or we should
Yeah, probably. Just to say, some form of positive discrimination is important. That's how society moves. If you realize that a particular segment of your population requires a bit of push, positive discrimination is allowed. So the society should be able to adjust so that we can put our women in the forefront. But at the same time, you still need the woman that comes up to say, I'm here, I'm ready to lead. Because if you create the opportunities and no one comes through, then it's still a wasted opportunity. And when you look at our schools, our universities at the moment, I believe, I'm not sure about Nigeria fully, but I do know. I lived in the UK, and I know more about that setting. Women were, at the time, over 50% of the enrollment into universities. So you can have this huge population, educated segment of your society, and you say that, they are not decision makers. Once they are thoroughly prepared and trained, then they should automatically, get into positions of authority and decision making.
Thanks, HM. Two more questions. All right.
Good morning, all. My name is Hadiza Abdul Wahab. I'm from Jigawa State. Actually, yesterday's presentation, especially in related to the Women Affinity Group, it's a better structure that we need to develop and sustain and make it wider, because that Women Affinity Group is giving the rural women a voice at the community level, especially in the northern Nigeria, whereby the rural women don't have voice. If the rural women have voice at their own community level, contributing to the development of the community, at least it is one step forward to improve the living standard, to reduce all the negative indices around the women in the northern Nigeria. I want actually the Women Affinity Group to be a better structure that will actually give more women voice at the rural area. Thank you very much.
Thank you so much. Maybe we can add one more question and then we finish up. Yeah.
Okay, it's not really a question, but I was very happy to hear that you're designing programs. You spent 4 days to design programs, but I'm very concerned when we start calling cash transfers empowerment, and that's Nancy's concern. When you give a woman money and she uses it to pay school fee, that's relief. That's not empowerment. So from the program design, what you call your interventions will really matter, as well as the KPIs you're going to be tracking. Are you going to be tracking just number of people reached, or you're actually going to be tracking number of earned income from enterprises? I think, the fact that you're still designing your interventions is very important, and you can go back to the drawing board and, firm up your nomenclature, firm up your KPIs. That will help us track outcome and impact eventually. Thank you.
Thank you, thank you. Thank you. Very interesting discussion. I had one question about, it seems many people in the audience are discussing the possibility of possibly, am I audible? Yeah. Okay. Graduating from cash transfers programs to women's affinity groups to possibly also more livelihoods interventions. My question is less related to that, more along the lines of Nigeria faces many shocks, many negative shocks related to climate, related to conflict. Of course, graduation is possible, but it's also possible that households and women fall back below the poverty line. When you think about the programs that you've been talking about, like how are you accounting for those negative shocks so that people who are currently in women's affinity groups may actually require cash transfers in the future because they face such adverse shocks, and like would be good to discuss some of that as well.
Okay.
Thank you. Go ahead.
Thank you very much. The question or the contribution on women affinity groups, I'm not sure about this, how that works, but from what I hear, it's empowering. It has to do with empowerment of rural women. I fully support that. In our targeting, whenever we are designing interventions, our targeting is towards the poor of the poorest, the most vulnerable in society. And usually when you look at our data, even from the Hub City program, rural dwellers get more of the intervention than the urban setting. So in that way, the targeting is done intentionally to reach rural dwellers. So I'll support the Women Affinity Initiative. Thank you so much. Thank you. And I'll come back to the question on cash transfer. If you listen to me carefully, I didn't call cash transfer empowerment. What I say is a stabilization fund, okay? Because cash transfers are meant to help during times of shocks in the system. And when you provide shocks, you are just stabilizing the individual so that you can then see how you will further help the individual. So it's just one-off. I am against one-off cash transfers all the time, okay? But a cash transfer that linked to a program that help individual, in this case, I call the poverty exit pathway, is what I advocate and is what I'm building. And I took office 4 or 5 months ago, and we are working on that. And we have gone in advanced stages of developing our new initiative. So I can assure you that I think alongside you, just the way you've contributed, that a desire should be measurable outcomes. And outcomes are not just in numbers. I have been to 4 states in the last 2 weeks, or a week and a half. Okay, personally, I have engaged with people, real people, beneficiaries of cash transfers. The thing is that sometimes we underestimate what those cash transfers are doing. I met people in one of the venues. I mean, people came around, and the only thing, I think if not for security reasons, they could literally lift me up because of what 75,000 has done to them. So these are important interventions. To most of us in this room, it may not sound as if it's not a lot of money, but for somebody in the rural area, in a state of vulnerability, 75,000 is a matter of, life-saving. I met a blind individual in one of my interactions with the beneficiary who used the 75,000 grant given to buy ugu seedlings, and now that individual supplies vegetable to local businesses. That is a testimony from real individual, even though that money was given as a shock relief. The person was able to utilize the money to develop a business. So the cash transfers are going out there and people are using it in different ways. But should that be the end point? No. We should be able to offer support. And that is why I'm wanting this artificial divide between humanitarian assistance and development must give way so that we have a continuous process. Once you're able to find or target an individual who is in a state of vulnerability and you stabilize them, track them to a program that will give them sustainability. Thank you very much. And the last question, I think I might have lost that question there, but it has something to do with the cash transfers also. Can you repeat that for me, please? Can we have a mic to the gentleman, please? Thank you. Yeah, go on. Okay, who fall back? Okay, thank you very much. Look at it this way. So I'm having a unified registry system. So currently, we have the National Social Register. The National Social Register is a register of 19.7 vulnerable households in Nigeria. And that is about, a household is about 4.5. You multiply that, it gives us something around 80 million, thereabout. It's a massive register, okay? And now, we utilize that register for targeting. From there, you're able to develop a beneficiary register. So in my new flagship, we don't stop there, okay? So we use the National Register, National Social Register, as a targeting tool. We move people into the beneficiary register. From there, when we put them on an exit program, a poverty exit program, they move from there to a national exit register. And from there, they move on to a national growth register when they're stabilized, when their business is doing fine. And we are not losing them. And we keep scanning. If they fall back, we're able to track them and then push them back onto growth. That is the design that we have. So hopefully, once we implement this, then people will not be lost along the way. Thank you so much.
Thank you, HM. Appreciation for HM. I think that's an excellent session. Thank you so much. Nancy, over to you. I think we took more time than.
Honorable Minister, even though he's in a hurry to leave, just give us a minute. Can we have pictures, please? Michael, please, to the podium. Can we have pictures? Yes. His table can join him too. Various stakeholders can also join him on the podium. How about the World Bank team? Ayo, you and your people, where are they? Gates Foundation, okay. Let's have the pictures. I think you should. Photographers, some people, how do we arrange?
just move it a little bit.
Wire. No, it's okay because they're wired.
It's okay.
Are we good? Thank you. Please, another round of applause for the Honorable Minister. Please shift it so that they can.
Thank you. Thank you.
Get him on the
Yes, I'll get him on my show.
on the show,
yes,
huh?
Yes, I will. So that he comes.
Okay. That would be good.
So we're going to the next session. Yes. Please, can we give the Honorable Minister another hand, one round of applause? What I know we did for sure with the Honorable Minister is we gave him task. Yes. We made him, think a bit. Just like I said yesterday, our role is to hold them accountable. Thank you, Honorable Minister, for your presence. Thank you. Thank you, and we wish you a lovely day. Thank you. We will be going right into the next session. Are we all on board? Yes, we should. Our next session will be looking at women economic inclusion. We'll be having the evidence presentations, of course, just like we did yesterday, and that is one critical area, women economic inclusion. And to start off, please warmly welcome with a round of applause Mahishwar Shretter, Senior Economist Social Policy at the World Bank, for the presentation. Oh, my friend. I apologize, for that name. So perhaps I would also appreciate you tell us how it's been pronounced. Thank you. Please, can we get for the presentation? Okay.
Good morning, everyone. Well, the presentation is being loaded. I'll get started anyways. Distinguished guests, everybody present, warm welcome. I'm Mahesh Shrestha. I'm a senior economist with the World Bank. And I'll sort of start with what the last panel left off, and hopefully by then, the presentations will be loaded and we can carry on. So you could see Honorable Minister already talking about design of what a flagship safety nets program would look like. You heard talk about graduation, exit pathways, and all of that. So I want to take you a bit back in time. This conversation started with the government about 10 years back, where we were in the verge of designing a program. And then the idea was, like, what would a national safety nets program look like for Nigeria? And that conversation started in multiple ways. There is the operational way, there is the policy dialogue way, and there is the data and evidence way. Honorable Minister also talked about the beneficiary stories that we hear when we go visit program beneficiaries of all these wonderful things that the program is doing. We wanted to add some evidence, rigorous evidence on top of that. So this is a long, ongoing conversation with the government, and what I'm going to present is one part of it, the evidence side of things. For some reason, okay. No. Okay. So let me start with the poverty situation in Nigeria. So when this conversation started, poverty was roughly around 40% of the population. But then, over the past 6-7 years, lots of crises has happened. And now you can see that the number is close to 63+%. It changes based on what metric we use. What is very, very clear is that poverty in Nigeria is high, no matter how you measured it, and that has increased. So what I'm going to present is going to talk about what Safety Net's program does in this context. And how gender fits in is that all of the beneficiaries, or virtually all of the beneficiaries, are women beneficiaries. Why women? I don't have to say that. First, women are, as Nancy said, women are the ones that bear the brunt of the poverty. And as Honorable Minister was saying, women make good decisions. When you put them in charge, we see results. So I'll show you some numbers that will hopefully convince you that's indeed the case, not just in the stories, but in numbers also. So this part of this impact evaluation was done in the context of the NASP program, and the government was very keen on identifying what policy will work, what safety net packages would work, and then testing it rigorously in the context of Nigeria. So 6 states were picked across the representing 6 geopolitical zones, and then 8,000 households in over 450 communities were selected for this intervention. And interventions were what were the interventions? And you'll see flavors of the last conversation come in here. So there is the basic package where people get the basic safety net regular cash transfer program. It was called HOOP, Household Uplifting Program back then. Now the modern iteration is the HOPE. It's Household Prosperity and Empowerment. So you'll see the change evolved there as well. But the basic package was a regular cash transfer program, giving $5,000 per household per month, and a savings and group mobilization effort, which is in some sense a predecessor to the WAGs that Nigeria for Women has really delivered on and expanded it massively across the country, right? So that was the first package. On top of that, the second package was what was called the co-responsibility, and this is what Nancy was referring to, the Brazilian Bolsa Familia model, right? So in Nigeria, it's hard to enforce conditionalities, but there were some co-responsibilities, and what households got was additional resources, conditional on them getting some support and training on health, education, nutrition, and sanitation. So that was the co-responsibility package. And third one is what was called the livelihoods package, which has the flavor of graduation that Honorable Minister was speaking about in the last session. So on top of that, life skills training, business development training, individual coaching and mentoring, group coaching and individual mentoring all were done. And on top of that, about 150,000 naira. And back then, inflation has skyrocketed in Nigeria, so probably like roughly over $230 would give you a good sort of benchmark. So that was given as a productive grants to the households. And this was done right. We were starting the program in 2019, and then COVID happened. So much of the implementation on the co-responsibilities and grants were done just after COVID in the latter part of 2020. And then all of the interventions were stopped in 2022 when the program closed. So what I'm going to present is how were the households doing in 2022, right when the program was closing, and how are the households doing now in 2025. So we did the survey just about 6-7 months ago. So we're showing the results, how they are doing now. 3 years later, when the country has gone through really tough times in terms of poverty situation. So what I'm showing here is focusing on the livelihoods package. So in the left panel, you'll see households, or you may not be able to see, so I'll just narrate it. You'll see impacts on different metrics of household welfare. So what you'll see at end intervention, their living conditions were better, their living standards were better, their consumption were better. And why were they better? They were better because their incomes from their household enterprises were higher. They were doing more enterprises. And not just that, if you look at their employment pattern, one of the common criticisms we see is that safety nets lead to people to be dependent. What we see is that they're actually working more. All of the household members are working more. The women that were directly supported were working more. So we'll see large benefit. And if we look at the children, because women, one of the reasons is that the impact are visible on children. And we do see that children are going to school more. That was when the interventions were happening. 3 years later, the impacts are almost exactly the same. So none of these households have gotten a single naira in terms of support, single facilitation in terms of support, single training. 3 years after the interventions have completely stopped, we still see higher consumption, higher incomes, higher businesses, higher employment, higher schooling among children. And even better, actually, what we see is that we're seeing some impacts on health. Their children are actually healthier. They're less sick. So I'll skip this. So the same livelihoods package, we looked at the impact on food security and nutrition as well. They were at end intervention. They were a lot more food insecurity really fell. And then nutritional diversity, they were eating different kinds of food, different nutritional variety of food. And that was okay when the intervention was happening because they were getting more resources and all of that. 3 years later, almost exactly the same. Food security has improved massively, continued to improve massively. Nutritional diversity stays about the same. And what we did this time around is actually measured their heights, because stunting is one of the big problems in Nigeria. Nigeria actually carries one of the largest stunting burden globally. What we see is 8 or 9 percentage points reduction in stunting amongst children that were under 2 when the program was being implemented. So this is massive impact 3 years down the road. So one more bit of nuance before I wrap up is that specifically on stunting, because that's such a powerful outcome that summarizes lots of things, the entire history of what has happened to the family, and it's a good indicator is what's going to happen to these children when they grew up. So it's a good summary indicator of the past and a good predictor of the future. So on that stunting, what we see is a very interesting thing. So there were some households who only got the lump sum grant. Those households, we see no impact or very muted impact on stunting. We see households that only got the training. There as well, we don't see much impact. There were households in which the children were a bit older. They were older than 2 when the program intervention were happening, when the households were getting some resources. We don't see any impact. So the only place where the impact is prominent is when all of those things are done right. It's targeted to the right households, so households with children under 2. And they were combined, they got the training, which told them what to do, and those trainings are on health, education, nutrition, and sanitation, all of them. And a large grant was provided on top, which, in addition to doing their businesses, probably allowed them to use it towards feeding their children better, and we see that impact. So the parting thoughts I want to leave with is that the evidence is there. As with almost everywhere when a rigorous version of this program is evaluated, we see a layered package of safety net intervention works. It works in Nigeria within the context of a government-run program, right? But what is also important is that depending on the outcome, design choices are really, really important. Oftentimes we see impact evaluations where we talk about successes, but we don't delve into the details of how exactly it was designed, what components matter, what components do not matter. Because as Honorable Minister was mentioning, the cost of these programs are not small, they're quite large. And it's always, the temptation is to scale down on something, right? So cut down cost on something. But what gets cut down is really, really important because there are some critical elements without which we don't see the same level of impact. And the third and most important question for Nigeria is, given 63% of the population is poor, how do we make this scalable and affordable? And it's a conversation that we're having with the government on how to design a program and how to do it at a scale that sort of benefits or that is up to the challenge in the context of Nigeria. These are really, really hard problems. We have one piece of the puzzle here with the evidence and data, and we have ongoing policy dialogue and operations to support that, but it's an ongoing challenge, and we continue to make progress. I'll stop with my presentation here. I look forward to discussing this shortly. Thank you.
Thank you very much. More evidence, and just like you said, I'm actually also looking forward to when the panel session convenes so that we'll perhaps a little bit more interrogate those data. All right, let's move to the next one. Our next presenter is Ms. Kehinde Ajayi. She's the Director, Gender Equality and Inclusion Program and Senior Fellow Center for Global Development. Yes, please, a round of applause for her. She approaches the podium for our presentation.
Thank you very much. My presentation follows up on what Mahesh just presented, and it is joint work with Mahesh, with Ayodele, and with a team of other people who we've been working on this for many, many years. And it's really building also on the conversation we had earlier about understanding how do we go from programs that are focused on stabilization, so supporting households to address income shocks, to really support their consumption in the short term, versus moving on to programs that are focused on, like the livelihoods package that Mahesh described, focused on skilling up and supporting households to move on to a path of self-reliance. And so the challenge that we were really faced with and engaging with in this piece of work and building evidence on is thinking about what is the best way to design these type of livelihood packages. So I'm going to drill down into that third package that Mahesh mentioned. And start off by thinking about the profile of the caregiver, who was the person that received the cash transfers, so the monthly basic income support. In 90% of cases, it was a woman in the household. So typically the first wife or the mother in the household who is really responsible for consumption, for well-being of the household members. But when we think about going to a program focused on self-reliance, supporting households to shift into a sustainable income-generating activity, the profile of that person might be different. So what the program called the productive member is the person who received this extra life skills training, business skills training, lump sum grant, mentoring and coaching to set up this income-generating activity. So one of the questions we were really interested in understanding is what is the optimal way for programs to identify the participant. And a lot of programs continue to work with the caregiver, so someone you have been working with to build up households' consumption support. But the question is that the ideal person for a productive grant? And then the second question is, are there ways to encourage household members to support whoever it is that ends up being this livelihood member? If you remember yesterday, Mike shared some evidence about how we know that women-led businesses are less likely to receive labor from others in the household, so other household members are more likely to offer to or to provide their income to support male-owned businesses rather than female-owned businesses. They're also less likely to receive capital, so any additional resources in the household. So we were interested in understanding, are there ways to encourage household members to support whoever it is in the household? So we're going to dig deep into this question of how do we select the productive member and how do we support this productive member to really maximize the impacts of these types of livelihood support grants. And so the two innovations that we focused on in this study is one, giving households choice of who should be the productive member, and the second is a household sensitization. So in our basic default option, the way this program was delivered, the caregiver, so the person who had been receiving the basic cash transfers, which in 90% of cases was women, typically you can think about the wife, the primary wife in the household, or the mother. So in one option, we had this person who continued to be enrolled as the productive member who received this additional income and training, as long as the program stipulations that they met of being between the ages of 15 to 45 and able-bodied. If not, households were encouraged to select another female household member to receive this grant. In comparison to that, we had another set of households where households were asked to choose whoever they wanted to be the participant in this program, as long as they were between the ages of 15 and 45 and also physically able. And then we also looked at the options of providing household sensitization, which was a short household visit, 2-hour facilitated discussion, where someone came into the house, brought together all of the adults in the household, encourage them to think about what are the different tasks that everyone in the household is doing, what are the different skills that everyone has, what is the potential that you can support each other to really act in economic ways that benefit the household as a whole. We also showed a video demonstrating, which is recording examples of people who had been NAS participants, people who had been receiving the cash transfers, and giving examples of ways in which male household members could support women in their business activities. For example, a husband saying that I look after the children when my wife goes to market. I'm the one who looks after the children, make sure that she can go there without having any additional considerations about caregiving. Or I use my bicycle or motorcycle to help her transport her harvest on days that when she's finished her harvest and is ready to take her goods to market. So the way we designed this study was we had these over 2,500 households that were receiving the livelihood package. Within that, we had half of them where the default was that the caregiver was the person who was encouraged to receive the livelihood package, and another half where households were given choice. And then we also had a half of households where they had this 2-hour conversation about household strengths and ways to support each other, and watch this video. So we can compare what happens when households have choice to when they don't have choice, and what happens when we have this sensitization visit and intervention versus not. And so what we find first, looking at households' choice, what happens when households have a choice of who they can have as the productive member? We see that some households do shift away. So 70% of households did have a caregiver, so they had the person who was receiving the cash transfers met those criteria of being within the age of 15 to 45 and physically able. So 70% of households in the control group continued with a caregiver. When they had a choice, we saw a decline. So in the dark color, that's the share of households that shifted away, or what happens to those households. In the first two columns, we see that households shift away from selecting the caregiver when they have a choice. Not all of them do. So a lot of households, the majority of households, continue to select the caregiver when given a choice, but some of them do shift away. And when they do, we see them switching towards picking someone who's younger in the household, typically 2.5 years younger. So the average productive member was 41 years old. When they have a choice, we see them shifting to someone who tends to be younger than 40 and about 2.5 years younger. We also see them shifting to female household members about half the time as they shift to a male household member. They're more likely to pick the head of the household, the child of the household head. We see twice as many households picking the child of the household head when they have a choice. So we see younger people being brought into this livelihood package. and more likely to pick someone who attended school. But we don't see any impacts on what happens to overall household consumption. So Mahesh showed you these long-term impacts we see on improvements in household income and consumption in the long run. We don't see any shifts in that. So this suggests that households, when they act with choice, are able to bring in younger people, but don't shift away from the impacts, don't compromise the impacts of the intervention. When we look at household sensitization, what happens here? We don't see, after this household visit, household shifting who they pick. We don't see any additional effects on economic activity on consumption, but where we do see impacts is improvements in women's mental health, so declines in experience of depressive symptoms, declines in anxiety, improvements in self-efficacy, so the extent to which women feel they have control over their lives. We also see, especially in the short run, reductions in experience of intimate partner violence, in experience of control behavior, so their partner limiting them in engaging in different activities. And we also see improvements overall in household food security. So just to wrap up, what this suggests, these additional innovations that we examined in this study demonstrate that there are opportunities to use households' information about different household members to optimize how this program could be designed. And this provides an opportunity to expand youth involvement. By giving households choice, we do see that they tend to shift to having younger people come in without compromising the impacts of the program. But on the other hand, getting to some of these questions we talked to earlier about what is women's empowerment, does cash alone really change the well-being of caregiver or women in the household, we do see that sensitizing households about ways to collaborate within and support each other does have these additional benefits on improving decreasing improving mental health, improving caregivers' sense of agency, and also decreasing experience of intimate partner violence. So we talked yesterday about ways to encourage more he for she's and really make this not just about women and putting all the burden on women, but bringing broader people in. So this study provides some examples of ways that we can move in that direction. I look forward to continuing the conversation on this. Thank you.
Please, a round of applause for Kehinde. The presentations so far this morning have been power-packed, insightful, and for more, because it has not ended yet. For more, please, let's clap for Yetunde Fatogun, Social Development Specialist, World Bank.
I think it's this thing. All right. So, no, this is the wrong presentation. No. So it's the social health insurance. Yeah. So while we're waiting for the PowerPoint to come up, I'll just give like a brief preamble. So good morning, everyone, once again. And today I'll be talking about the work that we collaborated with the Taraba State Government and the Taraba State Health Insurance and the Nigeria for Women project team. And I think for me particularly, this is a topic that is very close to my heart. Maybe some of you might know that I'm a medical doctor by background, and I always say that, you know, as doctors, we have like almost 10 competitors. We have Blood of Jesus, It's Not My Portion, patent medicine vendors, laboratory technicians, and, you know, so many people. So instead of seeking care in a hospital for different reasons, a typical Nigerian or an average Nigerian would rather go to these places first to seek care before they come to the doctor. And I think one other thing I always say to people, and maybe Nigeria for Women team, particularly the pilot state, will resonate with this. I think I even got the nickname health insurance under the parent project, is that you can have 20 problems, but once you have a health problem, all those problems just become one problem, because you would want to have good health to be able to address the other challenges that that the person has. I think that being said, this paper that I'm presenting this morning is a collaborative effort between the Nigeria for Women team and the Gender Innovation Lab team as listed here. All right. Oh, I think I went. Okay. All right. So I think a lot of us have talked about this high cost of out-of-pocket spending. Under the Nigeria for Women project, we realized that a lot of women were spending a lot from their social fund to address health insurance, particularly emergencies. And if you look at the context in Nigeria, about 77% of Nigerians pay out of pocket. We are yet to meet the Abuja declaration that states that about 15% of people should have health insurance, and it shows that about public health insurance costs about $29. If we do the maths, we know that it's not small money at all. Sorry. Okay. So what did we do? And I think I provided a brief background. The collaboration between the Nigeria for Women program in Taraba and also the Taraba State Health Insurance Agency, leveraging on the Women Affinity Group platform that we know as WAGS. And we collaborated with them to provide free health insurance with the Basic Healthcare Provision Fund for 12 months. We also had to do a lot of sensitization and advocacy. You know, I think it's one thing to just automatically think that once you provide people with health insurance, it's a given that they'll take it up or they'll even know that it's available. So what did we do for this research? So we did a randomized evaluation of the free health insurance that was provided. We had 30,000 eligible women that are part of WAG members, and we randomly selected 2,000 women that were given free health insurance, and we also had 2,000 comparison group. So when we did this, and what did we see in terms of results? So removing the cost barriers, realizing that women didn't have to pay, there was an increase in coverage, and also the use of hospital services. So if you look at the graph here, the coverage actually increased. If you look at the comparison group, about 6 times more, and there was also an increase in utilization. In terms of financial risk, and I think I mentioned this, a lot of our women are underserved, and they're just slightly above the poverty line. And with any health shock or any shock, they just come tumbling down. So I think this is a very important finding to show that it actually reduced the out-of-pocket spending, and it also reduced the expenses that you would use for large health shocks. So maybe someone gets into an emergency, someone needs to have a cesarean operation, there's a hypertensive patient or a diabetic patient. So last but not the least is that free health insurance works, but it's not automatic. So it would increase coverage, but coverage is not just enough. And maybe it's also important to add that, you know, once people know that they have health insurance, there's still an extra step or an extra mile that you have to go to ensure that they also are aware that this insurance is available and they're able to use them. Apart from that, enrollment is not just enough. Yes, we had a very good turnover in terms of coverage. 22% of them were able to attend the health facilities, but it's also important that we continue to drive enrollment. And at this point, I would like to add that we'll be doing, we've actually started another round of surveys, but what we also did in that period was to also do additional sensitization and advocacy. So hopefully we'll be able to see ramping up of numbers. So this will happen the survey will happen from now till October, and would, as I said, we already started the survey and all that. And I think for me, the last next step, particularly for all of us in this room, is for us to start thinking about when we go into our policy clinics, how do we integrate the learnings and the findings, seeing how successful this has been, and as we look forward to sharing the other results as we finish the final part of the survey, on how to see that we can integrate social health insurance into our various programs, particularly for vulnerable women. Thank you very much.
Where should I sit? Okay, at this point, let's invite back the presenters, Kehinde Ajayi and Maheshwar. Please come back to the podium, and you'll be joined by Mr. Mohammed Diko, head of NASCO, as the National Social Registry. Please, a round of applause for them. And Ms. Mary Sinjan, FCNA, ACTI, Commissioner for Women Affairs and Child Development, Taraba State. This session will be moderated by, of course, Michael O'Sullivan. Please, another round of applause for them. So I think at this point, Michael, I think you have about 30 minutes for the session, then about 10 minutes for the questions. Thank you.
Very good. Thank you so much, Nancy. Many thanks to the presenters. You heard some exciting evidence from large at-scale programs, right? So we're hearing about NASP, Nigeria for Women, and I think, we'd really also like to hear from our distinguished panelists today to learn sort of about their insights and their perspectives on what we've just heard and more broadly. So if, Mohammed, may perhaps begin with you. The evidence presented on livelihoods and household choice, of course, is promising. But it was generated in, specific states under specific circumstances and conditions. So NASCO's mandate is national. In your experience, how much of what works in a kind of well-resourced, closely monitored intervention actually survives this transition to full-scale implementation, right? So moving from, well-designed intervention, but at a smaller scale, to that larger scale. Kind of, in your view, what are those conditions in kind of whether a promising intervention actually can become a durable national program? And how are you thinking about these conditions as you're scaling up such interventions within NASP?
Well, thank you very much. I think I will start by saying once you want to bring visibility, it has to be, to some extent, data-driven. So what led to the success in terms of the NAPS project was it was built on, and driven by evidence of data, and then with specific target. And this brings us to, the building of the National Social Register, where, you bring out the poor people visible, so for potential intervention. So most of these evidences are coming from, just like what the minister says, from the National Social Register, which is a tool for planning and no particular, attachment to any intervention, where all these interventions mine from to deliver these services to the people. So you see, the evidence from the social register now entails, you know who you are delivering the service to, and then in terms of the allocation. And what we do of recent is we are adding digital, identity, as in terms of the geo coordinates of the households, in terms of, adding the NIN numbers, and then, the national ID numbers. So all these interventions, right from the beginning, are targeted, and you know who you are giving these, services to. And in terms of scaling up, you scale both vertically and horizontally. And what we are doing now presently is updating the data in the National Social Register, which the Honorable Minister has already mentioned. We have about 19.7 million households in the National Social Register, which translates to over 70 million. And 49% of those in the register are female. Mind you, from what Mahesh presented, the caregivers were the ones that received intervention in terms of the cash transfer. And I believe a money in the hand of woman translates to, good health, translates to food in the house, translates to entrepreneurship. And then, you see, so is the design of the NABs, particularly the cash transfer, is deliberate. And then the scope is expanded now by the government beyond the 2 million in NABs, now to 10.2 intended by design of the NABs scale up. But the federal government now have increased the number to 15 million. And where we are today in terms of delivery of the service is about 9.6 million. And imagine in your head, 9.6 million caregivers receiving 75 million. That is a huge amount of money in circulation and in the right hands. So if we scale up and the expansion is continuous, just like I said in the beginning, we are now adding value to what we are doing. We are bringing visibility to all those that are in the register by giving them, by linking them with the NIN, by linking them with the household coordinate, so you trace where your intervention is going. And apart from the community-based targeting, we are also looking at additional targeting mechanisms, which includes, apart from the income poverty, we want to now expand to see multidimensional poverty. Because from the last NLSS survey, because I don't have the recent figure, but the 1999-1998 is saying 41.1% of the Nigerians are poor. But the multidimensional recent one is showing 63%. And if you interpret this with what we have in the register, 49% of those in the register are women. That means we have at least more gaps to cover in terms of capturing, and expanding the register to bring in all those people that have fallen into poverty as a result of one, COVID, and then some policies that follow up after COVID. Thank you very much.
Thank you very much. Honorable Commissioner, yep, please Honorable Commissioner, I guess from your perspective, from the Taraba state government, it's one of the number of pioneering states where the health insurance model has been piloted. If another state government were to come to you and sort of ask, say they want to replicate this model, what would you tell them? What are the the preconditions in terms of state capacity, political will, provider infrastructure, community readiness that made it possible to implement this in your state? And how confident would you be to that those conditions exist elsewhere in other states across Nigeria?
Okay, thank you very much. Concerning the social health insurance scheme that took place then, women from the 3 LGAs, that's Bali, Takum, and Zing, enjoy it. They have access to free healthcare facilities then, and it makes life easy for them. It saved them of their out-of-pocket expenses. The money that they are supposed to use to go to hospital, they were able to use it to reinvest in their businesses. So it supports them seriously, and it gives them easy access to healthcare in the 3 LGs.
Very good, thank you. And I guess, to what extent do you think this is a model that can be replicated elsewhere? And what kind of advice would you give to leaders in those other states? Is that?
Pardon?
I'm asking, to what extent, is this something that you think other states should consider doing?
Okay, it's a very, very good program. I would advise every state to go into it because it's touched the lives of women, most especially the vulnerables, because these people that are beneficiaries of this, they are women that are from poor background, they are from the grassroots, and it saves lives. So I advise, if any other state wants to go into it, it's a very good thing because it supports the women in the grassroots.
Very good, thank you. I would like, thank you, please let's, Honorable Commissioner. I would like to maybe have our presenters come in on this question. I think if you get the thrust of the questions I was already posing, it's about the how. Okay, we've heard about the evidence and the exciting kind of evidence that we're preparing, but as we build out that path to scale, I'd like to hear some reflections. Whoever would like to go first, if Mahesh, Kehinde, Yetunde, so please, maybe we'll start with you, Mahesh, and we'll go down the line.
Thanks, and this is indeed very important question, right? So I'll focus on a couple of aspects. On whether it works in different places, I think there is some consensus coming around, right? So particularly for the livelihoods graduation package, it's been rigorously evaluated in over a dozen of different countries. And all of the findings are essentially pointing the same, large impacts, long term. So I'm fairly confident that if it happened in different parts of Nigeria, it would generate same kind of impacts. The question on scale is different and a lot more difficult. And then for my own reflection is that we assume scale is just like for a product. You have a prototype and you figure it out how it works. Now you need to sell it in more markets. But it's not at all like that, right? So when we scale intervention from a small pilot studies with 400 communities to over 250,000 communities that are in the social registry, the challenges, the scale of challenges will be hugely different. And I think pathway to scale needs to be combined with pathways of learning, tinkering, and doing, right? So you need to have that continuous sort of evaluation, learning, and adaptability built into it, right? And some of the things can be tested early on. For example, for the NASP impact evaluation, they were delivered through community facilitators that were local government staff. One of the things we tried to also see is, can we do community volunteers? With the exact same thinking that if Nigeria were to scale, it'll probably need a lot more workers, and relying on existing local government staff will not be sufficient. So will community volunteers work? We don't have the results to share yet, unfortunately, but those are the kind of thinkings that will change, and I think it needs a continuous sort of evaluation, strong M&E systems to keep getting that information almost in a nimble, real-time way, so that scaling is not just assumed or taken as an impossible problem and stopped, right? So it's a continuous process and a difficult process, but this is something that we have to do.
Great, thank you so much. Very important point around the kind of learning that needs to be built in as you try to build out these very ambitious paths to scale. Kehinde, would you like to come in on this point?
Thank you. Adding to what we've talked about, I think one important thing that stands out to me is the importance of really recognizing the different opportunities to support households. So as the Honorable Minister mentioned earlier, one entry point is thinking about stabilization, but when we think about the ultimate goal of self-reliance and households ultimately getting to a point of having long-term sustainable graduation out of poverty, it's really important to think about how, as he also mentioned, establishing the registry provides opportunities to support households in multiple ways and to support different individuals in the household. So going beyond just thinking of a household as a whole to really thinking within the household, who are the individuals that we can support and what are ways to support them. And on this, getting to the question of women in particular and jobs and markets, I think it's really striking to see that households themselves continue to identify women as people to invest in. And it can be an opportunity to think about supporting people of different ages. So thinking about youth employment, thinking about the multi-generational impacts of this, not just supporting the caregiver, who are, tend to be the more senior women in the household, but also thinking about how do we support younger individuals in the household, people who might be, recent university graduates or high school graduates who don't yet have work. What are ways to use these type of social protection systems, social safety nets, to really think about multi-generational impacts and then having sustainable interventions and addressing intentionally these questions of power, and not assuming, leaving it to women on their own to think about power, but really thinking about ways to use these programs also as a way to intentionally address the gender stereotypes, the entrenched views, beliefs that continue to reinforce gender inequality.
Thank you, Kehinde. It also reminds me of the Honorable Minister's point about not just asking for power, but also taking power, which I thought was a provocative point.
But just on that, I would say I really emphasize the, not leaving it to women, but having the he for she's that we talked about earlier, and the she for she's, just having everybody be a collective recognition of the importance of coming together to promote equality and really doing the best, because I think from earlier too, when women succeed, Nigeria succeeds. So I think that's really important for everyone to keep in mind.
Very good, thank you. Yetunde.
All right. I think for me, before even scaling up, the other question is, how do we sustain this? If women don't get free health insurance packages, how do we also encourage them to be able to pay for this health insurance service? And I think for scaling up, my advice or my guidance based on what I've learned working with the Taraba State Government, the Gender Innovation Lab, and also the state health insurances, we really underestimated the amount of stakeholders that we had to work with. I was doing like a list, and maybe if I can just reel them out, we had to work with we worked with NAPS because we also leveraged on the social register. We worked with leaders of faith and culture within the community. We worked with the Nigerian Identity Management Commission. We worked with NIMSI, because before you are able to get health insurance under the Basic Healthcare Provision Fund, you have to have a NIN, and you can just, the sheer amount of women that didn't even have a national identity, particularly in a local government like Bali, which is very far, we also had to work with them. We had to work with His Excellency, the governor, to also get that political will and buy-in. We had to work with the local government field supervisors. We had to work with the ward facilitators, and this is just the beginning. I didn't write some people's names. So I think in terms of scaling up, one important thing we need to take into consideration is the amount of stakeholders that you need to have in the room or continue to have conversations with. Funding is also very important, and that was what I talked about in trying to encourage, the women to be able to see this as something very important. We got questions like, if I don't use the health insurance, will I be able to get my money back? when we're trying to also implement it in other states, because we also did it in Ogun, we did it in Kebbi. We came up with models where we had to even use like health insurance volunteers. In Kebbi, we came up with like a federation model where we had a board of trustees. So I think for me, the learning is ongoing. More importantly, as we are trying to scale, leveraging on the different relevant stakeholders, but ensuring that as we continue to implement, we're taking all the lessons and we are contextualizing it to what we have. I think another critical partner is the National Health Insurance Agency. I think I wish that they were in the room with us today, but one of the things that we need to look at as we continue to scale up is how to ensure that there's a conversation happening between the states, particularly in the rural areas and in the local government and the National Health Insurance Authority. Thank you.
Thank you, Yetunde. So, we hear about scaling is an important learning process and the need for that, but we're also hearing, in a way, it's kind of a social process and the coordination, the collaboration needed across stakeholders to really build out that path to scale. So I know we have, this morning it seemed like we had a little bit of a shy audience, but I think that this is an audience that has an immense wealth of experience, expertise, knowledge, and tough questions. So I would welcome you all at this point to please raise your hand. You have an amazing panel before you. You're welcome to ask any questions along the lines that we discussed just now. Please do raise your hand and come forward. I see a hand raised in the back there. We have about 12 or so, 10 to 12 minutes for Q&A. We have a hand in the back here. Yes. Oh, and then we'll go, yes.
Thank you very much. My name is Mohammed Hassan. I'm from Jigawa State. Mine is a question just with regard to the social register, particularly with the issue of the update. Even though I know the social register was being built in collaboration with the World Bank, with the federal government of Nigeria, and currently the issue of update is ongoing. So my question is with regard to the sustainability of that social register, particularly with the issue of update. When the funding from the World Bank is no longer available, or what plan with the federal government of Nigeria has with regard to the update of that social register, because it needs update maybe 2 to 3 years after it was it is updated. Thank you very much.
Thank you. We'll take a few more questions and then I'll take it back to the panel, please.
Good morning. My name is Helen John, and I'm the Gender and GBV Expert Advisor under the AgriSal project, which is also supported by World Bank. Now, my question is to the first presenter. It was really interesting seeing the success rate, the high success rate, after 3 years of giving the support to these women. So I just want to know whether there were, and we have seen a lot of successes. So I just want to know if there were some intentional mechanisms or strategies put in place to curtail some of the negative impact. What I mean by negative impact is, we know that when women are empowered, especially when we're talking about the rural women, gender issues come to play. We have, the traditional and cultural reasons. So I just want to know if there were some strategies that were intentionally put in place, to cope some of these negative challenges. One of them is the issue of gender-based violence. When the women are empowered, that is one of the possibility. Another one is the issues around girls hawking. Instead of them going to school, the mothers now send them to hawk, products. And then I also will want to know what were some of the success factors that were put in place that made, the project, even after 3 years, it was still sustainable. So what were some of the success factors? Thank you.
Thank you very much. Great set of questions. We'll ask, we have a couple more folks. Please do.
Thank you very much. My name is Bamdel Oshiba. I work with Diadem Consult. So I have a follow-on question on the social register. I want to just find out, so you talked about updating the register, but do we have a mechanism for graduating households that are now resilient? And what's the frequency of that? And what's the methodology that the government will do so that, as people are leaving, other people can come in, and obviously makes this program cheaper in the long run? Because you don't always have, you're not adding on to the register, you are adding and you're graduating. Thank you.
Okay, maybe we'll do some first round of responses, and then we'll offer the floor once again the chance to pose some questions. So I've heard some questions, a couple of questions around the social registry and the sustainability of the social registry and mechanisms for graduating households. We also heard about, for example, on the NASP presentation, Mahesh, were there any intentional mechanisms to prevent essentially backlash, and also what were the kind of success factors behind the sustained impact? So perhaps, Mr. Dicko, would you mind starting us off, and then we can pass it, we'll come back. And of course, other panelists can feel free to.
Well, thank you very much. On the sustainability of the register, the building of the social register, just like I mentioned, started since prior to 2016, because it was inherited from the defunct ESO project. The coverage was about 7 to 8 states with few data, not more than 8,000 or so. But when it was inherited, the building continues. As of today, we are talking about from 8,000 to about 19 million. And from 2016 to date, the register is still there. NAPS and then scale up. And you heard this morning how the minister talked about, the ministry now, in their one humanitarian, one poverty system, now bringing in, onboarding the National Social Register as the cardinal point of data repository for the country. And then he talks about other, beneficiary registers. These are registers that are subsets mined by interventions. So you see, we are now talking about a national infrastructure. The National Social Register is viewed not only as a tool, but is a national infrastructure, a starting point in driving data-driven social protection system for Nigeria. And you can see the Honorable Minister has given the assurance of bringing on board the National Social Register, where we will now start looking at, funding, not from the World Bank and other donor partners, but government, from the government post, maybe through budgetary allocations. He talks about, the social protection, the trust fund, where, sustainability is about, to some extent, linked to funding. So if we can get a first charge level budgetary allocation to social protection in Nigeria, where we will not be faced with the issue of, non-release of data, of funding, of budgets and what have you, the first charge line for social protection at the national level, because we already have a national social protection policy where the National Social Register features significantly as a data point for all interventions, being it government or partners, to mine from them, because the register has brought visibility. Before then, you will be talking about 63%, 80% of Nigerians are poor. Who are they? Where are they? But now we have a place where you can go, see these Nigerians, and the beauty of it now is we are adding now digital identity. You can track the benefits. You will know where your benefits are going. You will know the households that you are giving, because they have what we call the Joe coordinates. So we are giving digital identity, improving over time the register. So I believe the issue of sustainability is within the scope of the government, and then the government is the major user of the National Social Register, where out of the 19 million, 15 million is targeted for cash transfer. And other donors are also utilizing. I can list about 12 to 13 at the federal level, about 21 interventions mining at the state level, because the social register is an aggregation of all the 36 states under FCT's state social registers. We are just aggregating the registers, but it's a mirror image. If you go to Adamawa, it's the same value, the same number you will see that is reflecting in the National Social Register. So we are now looking at the issue of, funding it by the government, just like the Honorable Minister assured us this morning. And then on the issue of graduation, the social register is not a beneficiary register. It is a tool where it houses, potential beneficiaries. It is you, the intervention, based on your criteria, that you now mine from the register. All we do is to track who mine what, and what intervention is going to who. It's at the beneficial, is at the program level that, okay, you now track to see, yes, these people are now graduating out of. And then we should be deliberate. That's why I said the issue of fragmentation is one issue, because there are so many interventions that are moving in silos. All we need to do is to know what is going on. Now, the 15 million that the government is targeting for the cash transfer, after the 75 million, where do they go? There are a lot of livelihoods that are going on across the country. You can link them. The output of the cash transfer can be the input of a livelihood project that is being run by a donor partner or a government, so that we can now graduate them from livelihood, SMEs, entrepreneurship, and then graduate them to a standard where they can even walk into a bank and collect loan to finance their businesses. So we are now moving them from protection to production. From protection to production.
Thank you so much, Mohammed. Excellent points. So Mahesh, perhaps you can quickly reply, and we'll see if there's time for one more question from the audience. I know Nancy is looking at me, maybe not, but please go ahead.
Yeah, just on the social registry, one more thing. As a World Bank, we've been supporting this institution and thinking about sustainability. So we had YESO, NASP Scale Up, and now NG Cares will be working towards making this more sustainable, both in terms of improving government financing, usage, and as Yatunde mentioned, also not just like the core programs, but health insurance, women affinity group, trying to link more intervention and program with the social registry. I think the more we use it, the more sustainable it becomes. On different approaches, I mean, I'll be very quick. Some of them are kind of, for example, why it was successful? Because it was delivered properly, right? So, and that is key. The intervention will be successful only when it's delivered properly. And now in the NASP scale-up, all of the cash transfers are now digital. So government can know the instant in which beneficiary has access to the resources in their pocket, right? So I think that way of doing things, making sure that it is delivered, I think is critical. On how the negative impacts are potentially managed, it's kind of, even the cash transfers were not just given as cash transfers. It was given as cash transfers to the caregivers, right? So that automatically, in people's mind, puts that it is for generally mothers, right? So although like not everybody was female, but that was kind of, the framing of that was an idea. And sort of, the program also has like GVV officers across parts providing support in case there is a problem. So as with most World Bank, almost all of the World Bank projects, we have that mechanism in place. But in terms of design as well, labeling it in such a way that it becomes clear that women is the intended recipient helps with some of these potentially negative issues.
Thanks, Mahesh. I'll also add that with the evidence that Gainde presented a moment ago on the household sensitization, that can kind of add another layer in terms of household cooperation dialogue that actually has also been documented to reduce reported intimate partner violence. So I know, is there one more question from the audience, a burning question? Anyone want to come in? And then we'll wrap it up.
Okay, thank you. My question is to Yetunde. In the cost you stated for the health insurance per woman, I think you said about $29 or $39. Was that cost inclusive of the advocacy cost, the marketing cost, the indirect cost because that will be the cost of the success you've currently achieved. And going forward, if you want to talk about the cost of the future plans, you know, have you considered the cost, the indirect costs, in the cost per woman that you've calculated? Thank you.
Very timely question. If you're talking about scale, you have to talk about cost. So,
all right, thank you. So the cost I presented for $29 was the cost that public health insurance cost, not the cost that was used to implement the project. So if you look at the beginning part of the slide, but in terms of calculating the cost, yes, we factored in, you know, we got free lives from the basic health care provision fund, but there are also some indirect costs that, as you mentioned, a lot of cost went into sensitization, advocacy, facilitating the NIN enrollment and all that. So those are some of the things that we are also factoring in to see how sustainable it can be. For some of the other states where we also did carry out this type of intervention, the states also use this convening power to negotiate with the state health insurance agency so that the women are able to pay less or also pay in tranches so that it's easier for them. But as you said, yes, it's important to factor all those indirect costs so that we know the real cost of what it takes to ensure that women are provided health insurance packages. Thank you.
Thank you very much, Utunde. Let's please give a round of applause to our participants in the panel. Look forward to carrying these conversations forward as we move into the action in the policy clinics. Thanks.
Yes, pictures. Please, a round of applause for them. At least from yesterday and today, we've tried to close the gap between what we know and what we should do. So please, another round of applause for this insightful session. All right, thank you very much. So we've had our morning fast spent. What's the time now? About 12 minutes to 12. So we'll be going on a tea break now. We'll be going on a tea break now. And I want to assume that the tea break would also be outside hall. Yes. So we'll be going to the tea break now. Let's use that tea break to stretch, to connect, and also reflect on what we've learned, not just this morning, and also continue that conversation. Most of those powerful ideas about policy does not even happen on stage. It happens between that kind of informal setting. Yes. Okay. Okay. and welcome back. Please, let's all settle down. We'll be going shortly into session 4, and after the session 4, we'll have our policy clinic, and we close for the day and go for lunch. So we just have about, okay, let me not preempt us, but what we have done is actually more than what is ahead of us. So thank you all for your patience so far, for your contributions, as well as for your engagement. So welcome back everyone from the tea break. We'll now turn our attention to one of the most important outcomes of everything we have discussed here in the last 1 day and a half. Jobs. I'm particularly interested in this because ultimately empowerment must show up in income, employment, and economic mobility. You know, because at the end of the day, especially in Nigeria, no one celebrates access to opportunity without results. In Nigeria, we like evidence, and we also like results we can see. You know, some people, show me the money, where the thing dey. Now we go chop. You know, we have those kind of humorous palaces here in the country. So to help guide this next session, of course, we'll be having our presenters. Session 4 is on more and better jobs for women. I'll be calling on at this time again, Ayodele Fashogbo, Economics World Bank Africa Gender Innovation Lab. Please, a round of applause for him. Ayo, you have 10 minutes. And don't come to me again with heartbreaking evidence, like yesterday, or something that will shock me again. All right, over to you, Ayo.
Thank you. Thank you so much, Nancy. I will try not to come with heartbreaking evidence, but they also help us to think through the findings so that our results can guide and not mislead us, especially where we say we have an intervention boost earning and providing some guardrails to tell us that these earnings capacity or potential are also moderated by the norms around women. So thank you so much. Let me go to the presentation for today. So today, I'm also speaking to one of our very long-standing study, building skill for jobs, improve earnings, and experimental evidence on youth employability and life skill training in Nigeria. I'll tell us more which of the programs or projects was this based. In Nigeria, like many of us know, especially with the new measurement of employment among youth is about 8.3%. Unemployment, rather, among youth in Nigeria is about 8.3%. And NEET, that is youth that are not in education or training or employment, is around 13.4% in Nigeria. These statistics, to a very large extent, like many people have argued, mask a lot of things, especially in terms of job quality for youth in Nigeria. As you'll see on the screen, on average, based on the latest National Living Standards Statistics Survey, the average earning, among youth is around 30,000 naira a month, compared to older adults, which is around 70,000 naira a month. And if you dimension this, you'll see that the earnings among youth is very low. And you'll see that there is a skill relationship. If you look at education, for example, and the earning capacity, you'll see that there is a major skill relationship in a way, or education relationship, or you may want to put it with earning. So we see here that there is an underlying mismatch in terms of skill among youth in Nigeria, be it especially within digital skills and soft skills. To address this, so that we can close this any gap and improve any potentials among women, we tested an intervention in a program in Nigeria about 5 years ago, and the program is called YESO, Youth Employment and Social Support Operation. And that program, or the project of the World Bank, which was around 300 million project size at that point, it has the social registry. That program was alluded to earlier today, where we're talking about the National Social Registry. It was the program that started the social registry in Nigeria in 2013. It has public works, targeted grant transfer, and the skill for job. We work with this program to see, to close the gaps in terms of any capacity and improve employability for youth, and to test which two packages works better. Layering social-emotional skills, or soft skills, as we refer to it on this particular program. Does it improve employability? Does it close the skill mismatch gap and improve employability and any capacity of the youth? Or providing job environment training in terms of apprenticeship? Does that do it better compared to just providing soft skills on top of the standard vocational skills? So this program has these 4 components. That's the 5th one, but I will speak to the 5th one later. So it has the vocational skills, and it has entrepreneurship skills, the life skills, the apprenticeship part of it. During the training, vocational skills was delivered for 20 days with the trainers recruited. Entrepreneurship skills was also delivered by 20 days, delivered by the ND, National Directorate of Employment. Just to also step back a little bit, that this is also in partnership with National Directorate of Employment. Then the life skills was offered within 10 days. Then the apprenticeship part of it, which exposed beneficiary to real-life training within the sector itself. That went for an average of 6 months to the designated sector. Then the beneficiary were to receive what was called starter pack. But there was a lot of story around that. That didn't happen. The starter pack didn't happen. The project closed, but eventually that was converted to a startup grant at the end, but our evaluation had already been completed by that time. In terms of timeline, like I said earlier, this program started in 2018. We had the baseline, we had the implementation around 2019. At the end of 2019, the COVID happened in 2020. We had the first follow-up during COVID in August of 2020, and we have the second follow-up around April 2021. Then a miracle happened. The startup grant was given after we were done with the second follow-up. In terms of coverage, this happened in 3 states, in Bauchi, Kogi, and Cross River. The design. So we had 3 treatments, and we have 1 comparison group. The first treatment has beneficiary randomized to receive vocational training, entrepreneurship training, while the second treatment arms have the additionality of life skills. The third one are the additionality of apprenticeship training. So you can see the design is a very addictive design. To see what does the standard vocational training deliver impacts, then if we had soft skills to it, does this deliver impacts more? If we had apprenticeship skill training to it, does it even deliver more? So that was where we were going. So what did we find? In terms of results, like I said, we had the data collections, a follow-up twice. So we found 7 months after the intervention ended, we saw some results on employment. This increased employment generally. We saw, to start with, we saw a high peak in employment across all the treatment, across the groups, even including control group. But what this intervention did was to increase diversification in terms of engagement in so many economic activities among those that received this training. And this diversification in terms of economic engagement was largely driven by unpaid apprenticeship. So many of the beneficiaries continued with those that they were posted to or found other players to continue the apprenticeship with them. This particular result was highly concentrated among men, especially those that are within the life skills arm. We see a very weak gain in terms of wage employment for women. Then, 15 months after, the employment effect plateau, we didn't see much employment gain. Almost everybody was at the same level, both those in comparison group and those that are in our treatment groups. But don't be sad, something very interesting happened after, which tells us the quality of impact of the training. So what we saw, 15 months in terms of earning, we saw that this training improved earning among the beneficiaries significantly 15 months after, compared to those that did not receive the training, especially the life skills arm and the apprenticeship arms. Increased earning among the beneficiary by about 33%. And we also see that the life skill arm also increased work hour, especially among the life skills, those that receive the life skills top up as well. Both the life skills arms and the apprenticeship arms also increased savings largely among the beneficiaries. For women, particularly, we saw a larger increase in total earning for women, especially those that are within the life skills arm. Many of them we also saw that even savings was more than double among women that were within the life skills arm. Lastly, in terms of results here, we saw very interesting results among intent to start a business by themselves. So we asked them, that is, within the last 30 days, did you try to set up a business? With that, across all the treatment arms, all of them, we saw a big result that many of them were planning to start a business in the last 30 days. For women, this intent is quite big compared to men. In terms of soft skills, we also saw a big gain in terms of soft skills, but this gain is largely concentrated among men. compared to women in terms of soft skills. So we saw that men had a bigger gain in terms of grit, self-efficacy compared to women. So let's bring everything together in terms of what can we take out of this study. So the main takeaway from this study, based on these findings, is that the vocational harm, which is the first treatment, provide the floor, that is the foundation for employment, for employability among these youths. But the life skill plus, the vocational training, entrepreneurship training, and the life put together is the most cost-effective of all the package, because just additional 10 days of training in terms of cost of the life skills on top of the foundational training increase earning to a very large extent and increase savings, especially among women. The gains in terms of earning is very big. The intent to start a business, especially for women also, is even compared to men. The apprenticeship plus HAM produced the widest impact, spanning both employment quality, savings, the life skills gain, but however, it is more expensive, especially with the additional 6 months apprenticeship training. With one thing to just add on the apprenticeship training, it is not just posting those youth to those places, it also it has an accompanying payment, monthly payments to the youth to encourage them to continue to go for the apprenticeship and all of that. So it is more expensive model. The soft skills plus, it's cheaper and delivers almost the same level of impact, but even bigger level of impact among women. So in summary, the life skills matter. The attitude design reveals that our life skills training arm deliver a more robust impact with at a lower cost. So thank you very much. I hope this resonates with many of us, and we can talk more about this during the policy clinics. Thank you very much.
Okay, Ayo was just saying that he hopes he didn't make me sad. No, not as shocking as yesterday. At least what was revealed that at least there are pathways. You know, there are pathways to it. So thank you, Ayo. Please, another round of applause for Ayo. So as we continue, let me quickly call on Arinze Nwokolo, Assistant Professor at the Lagos Business School, still talking about this session, more and better jobs for women. Arinze has 5 minutes. And please, I will implore that we look at that screen over there for time. Thank you.
Thank you very much. Nancy has said that I have 5 minutes, so I'll try to be as brief as possible. So this is a work that we have done with the GIL at World Bank, and it's on vocational training plus body program, and we targeted vulnerable women in 2 states, Adamawa and Bauchi. And by vulnerable women, I mean women with HIV. Sorry about that. Okay. All right, sorry about that. So one thing we have seen is that there's a lot of gender disparity between men and women in Nigeria. And this gender disparity is quite high if you consider the gender disparity in the north versus the gender disparity in the south. Because of that, we have decided to do an intervention in the north to see, is there any way we could increase the unemployment rate and also the income of vulnerable women within the northern part of the country. So what we did is actually doing a vocational training program plus a body program. The reason behind the body program is that we have realized that social networks matter for women, especially for women that are vulnerable. Vulnerable women like women with HIV that are likely to face discrimination because of the illness that they have. So what we decided to do was to do a vocational training program that has 3 components: technical skills training, a life skills training, and also an asset transfer that will encourage participation for the training program. Then we added a body program to that. And the question we're trying to ask or address here is, if we combine the vocational training plus the body program, is there an increased impact in the effect of income and also employment for these women? So what we did is we selected about 2,887 women from these 2 states. We divided them into groups. So as you can see on the screen, the groups are 255 groups across the 2 states. Then we assigned like 3 treatment groups. So the first treatment group has to do with vocational training, life skills, and the asset program. So that was 64 groups. On the average, there are about 710 women for each group. The second group is vocational training, life skills, asset, plus the body program. For this particular group, there are about 1,441 women for this group. And then in the control group, we have 63 groups, which is about roughly 727 women here. Now, what we see as the impact is there's a suggestive evidence that there's an increase in employment by approximately 4.4% for these women, and also in income by 6.4%. And then this increase is actually driven by social networks. So the women try to interact with one another, they help one another, and with that, they are able to actually increase their employment rate. When I mean by employment rate, I also mean self-employment. So they actually start up their own business, and they're able to generate income for their families. So what is the lesson that we can learn from this? So vocational training is effective, and social networks is also very important for women that are quite vulnerable, especially in the country. And that if we're using this kind of interventions that are actually quite innovative and cost-effective, there's a likelihood that we can reduce the gender disparity between the labor market in the country. Thank you very much.
The efficacy of him observing that time is so, I was still thinking that the story is still ahead. Thank you very much. So I think it's time now for our panel. Yes. Time for our panel. So let's have our 2 presenters back on stage. Then at this point, let's have the Permanent Secretary, Ministry of Women Affairs of the State Government, Ms. Folorunso Obienu. Huh? Oh, yes. Folusho, there's a difference between Folorunso and Folusho, yes. So, Ms. Obienu, please, a round of applause for them as they go on stage. And Ms. Hawa Haliru, Director, Gender Affairs, Nigeria Governors Forum Secretariat. We also have Ms. Tura Rufai, Education Specialist, World Bank. This applause is not motivated. It's anemic. Thank you. The last but not the least, Dr. Kenneth Pujeli, Director Plans and Project, Federal Ministry of Budget and Economic Planning. Where's Dr. Kenneth? Okay. Yes, my brother. Please, a round of applause for him as he approaches the podium. And to be ably moderated by Ms. Kehinde Ajayi, Director, Gender Equality and Inclusion Program, and Senior Fellow, Center for Global Development. She was one of our presenters earlier. So please have your seats. So this panel is for 30 minutes. Yes, that's what I have here. Michael did his in 30, so no partiality.
All right, thank you very much, all of you, for staying with us through this panel. As you can see, we have a wonderful group of panelists to continue this conversation. So I will start by asking each of our speakers here to briefly answer a first round of questions, and then we will have a response from the two presenters, and then open it up to questions. As you heard, we only have 30 minutes, so you should be preparing your questions as we go along so you're ready to ask them as soon as we start. So I'll start with Dr. Rufai. One of the most consistent findings across both of these presentations is that skills training for women works best when it does not stop at the classroom door. So when it's paired with workplace exposure, peer networks, startup capital, or life skills. Yet, Nigeria's formal education and training system is largely designed to deliver content in a classroom and then release participants into the labor market that may not be ready for them. What would a genuinely enabling skills system for women look like in Nigeria? And around the full journey from training to sustainable employment, or not just the training episode itself? And which actors, government, the private sector, development partners, would be needed to build it? What would they need to do to build it?
Okay, thank you so much, Moderator. I'm Kenny. So, a truly enabling skill system for women will be one that is demand-driven, gender-sensitive, and one that also addresses the barriers to female participation in the skills ecosystem. Let me break this down. By demand-driven, I mean trainings must match employers' needs. So when we are designing the training, when we are putting together the curriculum, it must be designed in partnership with the employer, which is usually mostly private sector, and with employment in mind. So when you're doing a training, the end goal should not just be, I'm training and that's it. The end goal should be employment at the end. So it starts right from planning. Another thing is this training, I just presented, Fashoba, my colleague just presented, overlaying training, not just with the technical stuff, but bringing in life skills and soft skills like communication, negotiation, social-emotional skills. That is very, very important for employment. Also, layering it with mentorship. For women, mentorship is very, very important, especially from established female leaders, especially in like the north here, in the northern areas where girls need to see other females that have come from the same background as them as doing well. Another very key important point is addressing the barriers that prevent women from participating in the skills ecosystem, like access to childcare, security, transportation. The beautiful thing about this is that women themselves can be empowered to fill these gaps. For example, childcare, as we're doing under the IDES project, which is a TVET project that is implemented by the Federal Ministry of Education but supported by the World Bank, where we're beginning to train women on how to provide childcare. So some of them can be working, taking care of the children, while other women go to the field to work. A very, very key important part of it is also quality assurance of these trainings and certification. So how do you ensure that the training that women or youth receive is based on a framework that is trusted by the employer, is recognized and is trusted? So when you talk about the formal sector, for example, we have traditional apprenticeships that are not based on any standard curriculum. They are not based on any defined duration. So you could be an apprentice for 20 years or 10 years, and you continue to be an apprentice. So what we've done, what Nigeria is also doing now, is rolling out what we call the National Skills Qualification Framework. This framework is designed in partnership with the private sector. So they know about it. And it helps young people, women, to participate in traditional apprenticeships with the mind that they will get certification at the end. And it's a competency-based system, so you learn by knowing how to do. So the employer knows what you can do based on the level of certificate that you have with you. So it's still new, but we're trying to roll it out. So under that framework, what we have is National Board for Technical Education, that is in charge of technical education in Nigeria, has a database of polytechnics, that's formal education, of secondary schools, TVETs, technical colleges, and then also of private sector that have been accredited to provide training under the National Skills Qualification Framework. So you have an arm that focuses on the formal and another one that focuses on the informal sector. And what this does is that it brings in a lot of flexibility for women and mothers and youth and young people to say, I don't want to go to school. I want to be in the informal apprenticeship system, and I want to take some certification. And the interesting thing about it is that the levels of certification under the National Skills Qualification Framework have equivalencies with certification in the formal. So I can have a level 3 under the National Skills Qualification Framework, could be equivalent to an ND in the formal, and it progresses like that. So, and the last thing I'm going to say is to support women, to ensure that women participate in skills. Employment is to complete the training and support them with financial grants, with equipment, with support, mentorship support, such that they get the support and they're able to, if they decide to start a business on their own, they can go into businesses. If they decide to do a business on their own, they can launch into their business. So I will stop there.
Thank you for sharing that really rich response to this question. And as we go, before we go into the second question, I just want to share for you all this resource on pathways to prosperity for adolescent girls in Nigeria that's just been published by the Africa Gender Innovation Lab at the World Bank. You can find it online, and I think there's some copies outside here too, which, as you mentioned, is not just thinking about women, but also youth and adolescent girls as they're transitioning into becoming women, because these are the people who will be the future of employment for women. So important to think about the adolescent girls and the transition to women. And as I go to the remaining questions, I want to remind you all that we do have a lot of perspectives to share. So I encourage you to please be brief in your response so we can have time for questions and a broad, engaged discussion. So I'll move now to Madame Obienu from the Ogun State perspective. Ogun State is home to one of Nigeria's most significant industrial corridors, with a concentration of manufacturing, agro-processing, and logistical firms that employ large numbers of workers. It's actually relatively unusual, an asset for a state government to have that's trying to create jobs for women, because there's a private sector to engage with and physical proximity to Lagos that creates additional labor market opportunities. So to what extent is the Ogun State government and Ministry of Women Affairs actively working with these firms to increase women's employment, whether through targeted recruitment, workplace policy, supply chain linkages, or anything like that? And what has the response from the private sector been?
Thank you very much. Thank you for having me here. I bring greetings from His Excellency, Prince Dapo Abiodun, the Governor of Ogun State, who is very passionate about women economic empowerment, and also the women of Ogun State, who have benefited so much from the Nigerian for Women project. And the thing is that it's a game changer in Ogun State. It has taken them from a very low level to a very high level. Their means of livelihood has increased. And from the video, thank you very much. From the video that was shown yesterday, some of our livelihood collectives were shown. It has improved their lives tremendously. And for us, economic empowerment is not because it is just and fair. It's our strategy for growth, for prosperity in our society. So we're all into it. Dr. Leary yesterday was talking about political will. You can be sure that in the leadership of Prince Dapo Abiodun, we have that political will. He keeps pushing us and providing funds in addition to what World Bank and the federal government is providing. So we're really grateful for that. Now to your question. For us, it's basically in respect of supply value leakages. You know, we have what we call the livelihood collectives, which is about 61 in number, and they have brought together over 600 million from their savings and given out loans to over 7,300 recipients among the WAC group. And in addition to it, what the government, now coming to your question, what the government is now doing in partnership with the private sector is ensuring that we invite WAC women to supply raw materials for some of these companies. They're cooperating with us. They're asking WAC women to supply raw materials like rice, like maize, like corn and maize are the same thing, and some other things. So that is the partnership we're having with the private sector. Secondly, they're not only sourcing for raw materials from us, but for they're making use of women entrepreneurs in some of their contracts and calling them to do other things for them. As per targeted employment, we're emerging as a state. We're not really into that. But what we have done to engage the private sector is that in addition to the we policy, we have drafted a bill called the Women Economic Empowerment Trust Fund, which will include the private sector. And it's drafted. We've not presented, it's gone to the House of Assembly, but they've given us their additions. It's gone to the Commissioner for Finance. So we have all the stakeholders involved. And what this trust fund is all about is to provide financial support to women in order to bridge the gender gaps in economic opportunities, promote sustainable women empowerment as a strategy to reduce poverty, employment, and other objectives. Now, the reason why, I'm very sorry, let me just say this. The reason why this trust fund is very essential is that after the end of National for Women project, what next? So we need a trust fund to be sure that these women can expand their businesses and take their businesses to the next level. And where they are innovators, they are sure that there's a fund waiting from them from which they can draw and get better. Thank you very much.
Thank you. I really appreciate your discussion about the sustainability, something that came up earlier on. So thank you for sharing about what your state is doing on that issue. We'll next move to Ms. Haliru. From the Nigeria Governors Forum has a visibility that few institutions in Nigeria share. You work across all 36 states and FCT, which means you can see patterns that are invisible at the federal level or in any single state. The evidence presented today was generated in specific states and specific contexts and specific communities, but we know that women's labor market outcomes vary dramatically across Nigeria. So from your vantage point, what explains the most significant variation you observe, and what does that diagnosis of the main drivers of this variation, how does that diagnosis what you think NGF's role should be in expanding women's economic opportunities?
Thank you so much, Kendi, for this question. So yes, the Nigerian Governors Forum, it's a subnational platform that promotes good governance. And what we see from where we stand is actually a bird's eye view of what obtains in all the 36 states of the Federation. So we see as major significant barrier between the two geographical zones. We have the north and the southern divide. So you can clearly see, even from the presentations that were made, one of the presenters, the latest presenter, mentioned the fact that they had to go to the north because they realized that there's a lack of literacy level that affects women's labor participation in the north. So this is one of the things that we see at the Governors Forum. We see that there's the geographical divide. There's also the literacy level in terms of where the women are at the southern part of the country and the northern part of the country. But because what we try to do at the forum is a holistic approach to ensuring that women are empowered across the 36 states, we ensure that the policies that we're driving, to be specific, the Women Economic Empowerment Policy, is contextual in nature, so it takes care of all those variations that you find in the different states. So in the north, where you have mostly the business is dependent on agriculture and the women going to subsistence farming, the focus is mainly on agriculture. Although it is low in terms of, it's more like an informal sector, we're trying to see if we can grow it to the level where the women are empowered in terms of building their capacity. For instance, the state just delivered a 5,000 training to 5,000 women on data science and artificial intelligence, just so that they can build their capacity to be able to compete with their fellow women from the other region. And we see the Nigeria for Women program, which everybody is talking about here, that has done greatly well. The forum has taken up, 32 states already have onboarded, and that is the level of commitment that we have seen with the governors. Again, they had to commit because one of the things that they thrive on is peer learning and knowledge exchange, just so that every state is covered, every woman in every state is not left behind. So in fact, I was just, when my colleague here mentioned the We Trust Fund, in my mind I was like, okay, this is another best practice that we would definitely take on board when we leave the space today. So this is some of the things that we're looking at, and this is majorly the difference that we see. So building the literacy capacity of women in the north, just so that they compete with others in the region. The southern part, fortunately, has a market that is private sector-led, like she rightly mentioned. So they have a pathway already to employment. That is not obtainable in the northern part of Nigeria, but we are also trying to see what we can do to bridge the gap so that everybody is given a fair level playing ground to be able to be empowered at the end of the domestication of the policy. We are looking at 16 states at the moment. We have our 3 front runners, Kaduna, Kano, Lagos, and then we're scaling up to 16 additional states. And this policy is definitely a game changer for the Nigerian women. And Nigeria for Women program, of course, is another additional game changer for the Nigerian women. We hope that at the end of this dispensation, and we're looking at 2027, we'll have 36 states domesticating the We policy that will definitely change the lives of women at the state level.
Thank you. Thank you very much for sharing that perspective on how this is, what are the ways to domesticate the We policy and really take into consideration the specific factors influencing women's economic opportunity in each state. So I'll turn to you, Dr. Kujeli. So one of the most important questions this forum raises is not just what works, but who is accountable for making it happen. The Federal Ministry of Budget and Economic Planning has unique accountability function through the budget process, through planning reviews, and through performance monitoring to ask whether public investments are delivering results. To what extent is gender currently part of how your ministry evaluates the performance of federal programs? Are there mechanisms through which a program that consistently fails to reach or benefit women would be flagged, adjusted, or redirected? And if those mechanisms do not yet exist in a meaningful way, what would it take to build them?
Thank you very much. Again, like other colleagues, let me appreciate you for giving me the opportunity to be here this morning. The The response to your questions are very easy. You know, federal government is the father to all, to ensure that our system, whether female, male, young, old, works. We start by ensuring that we have an operational document that takes care of all concerns. Now, when you come to the women, for the last part of, let me say 2-3 years ago, we came up with a plan. And that plan was 2021 to 2025. What we did was to ensure that women are provided a very important, cover important chapters that deals with their development and also deal with skills and employment opportunities. What we now try to do to ensure that this, again, is resolved, we are looking at mainstreaming the gender components in the new plan. We had it in the past one, but at a point, my friends like Khadija and Co put pressure on us to say that they needed to review the document to ensure that this time around that we're having 2026 to 2030, that it has sections or chapters that accommodate the women concerns. So what we have just done is that to ensure that no one is left behind, especially the women. We had a section recently, and we invited the females, the teams that works on gender, and we gave them opportunity to work with all the ministries, departments, and agencies. We had over 50 of them, and we gave them opportunity to work with each of them to ensure that the sections and the chapters reflected in the plan takes cognizance of the needs, and to ensure also that women are given appropriate places in this new plan that is going to stretch over 2026 to 2030. And remember that what is the plan talking about? It's talking about growing an economy to a level of having a nominal gross domestic product of $1 trillion by 2030. That also means that given the current positions, it also means that the economy has to grow, pursuing like a double digit. And how can this work if the women that are not given the right role to play? So what we have also intended to do is that in the course of doing that, you know, when you develop a plan, you follow it up with lines and chains of activities. So it is those activities that has to be costed for it to be budgeted. So what we now intend to also do is to ensure that all these discussions and other things that have been said is that we try to factor them into activities, programs and projects, as probably from next month, and then also give rooms for it to be costed and also for it to be presented for purpose of budgeting. And I believe when we do that, then releases will now naturally flow for us to be able to meet the needs and desires of the women generally. Thank you.
Thank you for bringing that perspective and sharing the importance of budgeting for all of these elements in order for them to have the results that are desired. I'm going to open it up to questions so that we can have, and feel free to pose your questions to the presenters or to the panelists who have spoken now. We'll collect a few questions before opening it back up to the panel to respond briefly to the questions. So I asked you to start thinking about them, so I hope people are ready now to to ask your questions. We have time for about 3 or 4 questions. So we have that first one in the back there.
Good afternoon, everyone.
Please be brief with your questions also, so make sure they're directed questions, and introduce yourself too, please.
Okay, thank you. Ham Oyedron Wasil from Federal Ministry of Agriculture and Food Security. So my question is going to be very brief, and it's going to be directed to the Permanent Secretary from Ogun State, because Ogun State is the hub of agri fabrics in Nigeria and perhaps in Africa, because of the profit they are making for the business. And they have their own indigenous way of apprenticeship. My question is this: how does the Women for Development Project embrace and transform this informal sector to a formal sector? For example, in the past, we used to have a phrase, tailoring. Now it has been transformed to fashion designing. Do we have such a place in Ogun, such a thing in place in Ogun State? Secondly, what are the measures, innovative, finance, trading, policy that are put in place by the Ogun State government to protect the women in agri business and be able to compete with external competitors, especially the Chinese people that are aggressively importing agri into the country? Thank you.
Okay, do we have an additional? We have one more question at the front here, and then the last one at that front table.
Well, thank you very much. The name is Mohamed Dikobala. Well, one question, 2 comments. The first comment is still on Ogun State. Because if we have the supporters among all the governors, the first supporters of the National Social Register, I believe, is Governor of Ogun State, Governor Dapo Abiodun. Because I remember when in 2020, when I visited the state, I received a tremendous support. And it's one of the governors that has been since then committing funds in expanding the social register without asking for payment from the federal. Since with this level of commitment, I want to know what is the level of the utilization of the state social register in Ogun State, because I can see visibly a commitment by a governor from 2020 to date, expanding the registry. That means including women. So if it can be expanded at the cost of the government, what is the level of the utilization? And then this is the question. That's the question. Then the other comment is on the TGT. The TGT presented there was a targeted transfer, and it was not directly mined from the social register. It was a subset of a social register where we have the unified register of beneficiaries. We have that register for IDPs in the Northeast. So you can find this type of register across all the 5 states. So now, Doctor is part of those people that implemented YESO. So I want to tell him that part of the efforts we are doing, we are testing an SOP we call the Data Integration Protocol. Now in bringing in all those people that were in the IDPs that were returned back to your communities by the state governors, particularly if you go to Borno State, there was a point in time when almost more than half of the local governments were in the IDPs. And I think that was when the TGT was, administered. So what happened to those people when they went back to their... So we are now integrating them back into the social register using a data integration protocol, and we are extending same to the refugees, so that when they return back to their normal communities, we now use the same protocol to take them back. Thank you very much.
Thank you very much. So this last question at this front table, if that could be a brief question, and then we'll open up for brief responses. Thank you.
Thank you. Good afternoon, everyone. My name is Leah. So the presentation by Ayo and Arinze actually showed a comprehensive approach to skill building, looking at the vocational skills training, life skills training, apprenticeship. But I wanted to ask Ayo, when you looked at apprenticeship, was there a difference in completion by men and women? Were the women able to complete their apprenticeship program, since it's a long time of 4 to 6 months? And then also, you mentioned that you couldn't give startup grants, startup kits, and so you gave a startup grant of 150,000. Were you able to assess to see if that amount was actually able to help them start up a business, 150,000? And then, Arinze, I would like to understand more about the body program. What does it entail?
Okay, so we'll go through those questions. There's a question for Madame Obienu about the Ogun State. There's questions for the 2 presenters about their presentations, and then if anybody wants to respond to that, the additional questions. So we'll start with you then.
Okay, thank you very much. I'll start with the question of the gentleman at the back with respect to what measures is Ogun State taking to formalize some trades like fashion, tailoring into fashion designing. What Ogun State has done is to buy sophisticated equipment. We have what we call Women Development Center, and training is free. So we always encourage women that have been trained in the skill of tailoring to come for further training. So we have one in Abeokuta, we have one in Shagamu, we have one in Ijebu-Ode, and normally these learning of skills take about 6 months. So most of them come. Then another one is Nigerian for Women project. The livelihood collectives, they have sets of sophisticated instruments, and women, the work group, they are free to come in and use those instruments for their own good. That's number one. Then number 2, talking about Adire and the fact that there's a competition from China and all that. In as much as we have not done formal registration of the right over Adire, we have put several things in place. You can always tell the difference. They have not gotten the skill. They don't know the know-how in producing, China, in producing the real Adire. For example, in Ogun State, no civil servant is allowed to wear any Adire from China. You must wear the indigenous Adire. And then every Friday, every civil servant is mandated to be in Adire. And then we have And when we come for such programs as this, you find out that yesterday I was in Adire. Today I'm in Adire. It is actually deliberate and intentional. We are putting forward our product. And the thing is that we have regular trade fairs where we sell out Adire to the people. Then we have, the government is building Adire hubs in all the senatorial districts. And also, the WAG women receive orders from America, from UK, to produce the original Adire. Of course, China Adire is cheaper. Why are they not going to China? Because they know the quality, they will get better quality in Nigeria. Thank you very much.
Thank you. I'll go on to those to the presenters to briefly respond to those questions, and we will have the policy clinics coming up later, so you'll have an opportunity, and also at lunchtime, opportunity to speak directly to any of the speakers to continue the conversation if you weren't able to get a response or didn't finish the discussion you wanted to have. Okay, so
all right, thank you very much. I think I have just two questions, if I'm right. The first one is from my brother, Diko, on the targeted grant transfer, which is for sure different from what I presented, but was a component of the project, which was based on the registry of the internally displaced person. And that registry is also seated with the National Social Safety Net Coordination Office. And I believe the government was working on integrating that registry with the National Social Registry at some point when I was working with the team. So I think this is a conversation that we can take on the side to know how far the government has integrated that registry with the National Social Registry. But to go to the point on, maybe just to reemphasize that the Skill for Job program was also based on the social registry, was based on the households within the social registry. There are a lot of other technical stuff to be discussed, especially if you see the sample size. You see the sample size is a little bit smaller than the average sample size that you've seen on other studies today. So that is one of those reasons. So it's based on the social registry. Completion rates of apprenticeship and impact beyond startup grants. So thank you so much for raising that. So in terms of completion rate on the experiment generally, in terms of technical term that we use is take-up. Our take-up is around 68% on completion rate among the beneficiaries. And in terms of differential uptake between women and men, a little, but not so much in between the two. Lastly, on startup grants. So we have not collected any follow-up data after the startup grant. So this experiment, all the findings here are before the startup grants. Thanks.
Okay, thank you very much for the question. So I'll just be brief and to the point. Your question is, what does the body program entail? So the body program entails the women coming together, being kind of assigned groups that will help them participate better in the program. Given that they are vulnerable women, it is always, it's advisable that they are actually in groups because they encourage one another and help one another to actually participate in the program and see the program through. And that is part of the thing that social networks actually helps with. That by being in a group, you are able to kind of utilize the network or the connections that other women have, and you are also encouraged to be part of the program, knowing that you are not alone. So that is why we actually brought in the body program to encourage participation and also to help the women to realize that even though you might be discriminated by the society, but they are
I'll hand back to you, Nancy, to take us through the next stage. But thank you all for this conversation, and we look forward to continuing the discussion.
So thank you very much to the presenters and the panelists. Thank you very much. Thank you. Please, a round of applause for them. So now we'll move to the next item, which is almost, we're at the border to closing, almost. But for this next item, I'll be inviting, let me say it's the final segment, I'll be inviting two ladies. Yesterday we heard from one of them. We heard from Yetunde Fatogun. She talked about the policy clinic, so we'll be having that next. So let me quickly invite Yetunde Fatogun. She's presented earlier on. Please, a round of applause for her, as well as invite Khadija Atamolegbe. We also heard from her yesterday. Professor Khadijat, are you saying she should be the only one? She's capable. So are you ceding it to her that she alone can take charge? Okay. So let her doctor for you. She's a doctor, Yetunde, and profess for you too. So I wonder how the policy clinic will look like. So over to you, isn't it?
All right, thank you very much. Please, can we have the slide for the policy clinic? All right. So for the purpose of this session, I'll just be taking you through what we expect the people in the room to do. But the good thing is that we're going to be having facilitators assigned to each geopolitical zone and at the federal level too. Okay, I can't really see, so I think I need to move. Okay, fantastic. So we're supposed to start yesterday, but we actually moved everything to today. So what we're going to do is that we're going to provide a summary of all the things that have been discussed till date. So for the first day and the second day, a summary sheet will be provided on each table. Please, can we confirm that we have that ready? Fantastic. Then the second thing, let me just do a bit of housekeeping, is that are we merging tables? We have 7 zones. So we have Southeast, Southwest, South-South, and we have the federal. So maybe we would also do that immediately after so that we can have people. Third thing before I go into the meat of the matter is that please, for the programs that we have here, so we have LPress. I saw some people from Acrisal, and I think I saw my sister from NAP Scale Up. So it will be good for us, as many as possible, to be on each of the tables. So if you're on MNFWP, please make sure that you stay on either South-South, Southeast, because we also need a lot of your insight. If you've worked on appeals, if you worked on YESO, it will be important that we also have people that have implemented to be on each table. For each group, you need to have a note taker, a rapporteur, and a laptop. We'll be sending the deck to you so that whoever you choose, you'll be able to get the information into those slides. And we'll assign a facilitator, which I'm going to share. And please feel free to ask the facilitators or anybody from the Gender Innovation Lab, the Nigeria for Women team, questions. So these are your facilitators. Kende and I would be working with the federal. Professor Khadija will be working North Central. Minal will be Northeast. Garima and Yvonne will be in group 2. Dr. Arinze or Professor
Maybe I come from a background where if you don't put people's titles, they won't even answer you. So if someone is a doctor, if someone is a professor, if someone is a mister, a surgeon, if you call him doctor instead of mister, he won't answer you. Then group 5, we have Neka and Uche Osai. And for Southwest, we have Nelsie and Anna Kalashian. So please feel free to, and if you have experience in the different geopolitical zones, feel free to also stay there. So the first question is, out of the innovations that have been discussed or the evidence, which one resonates with you or your state or your program and your project? So maybe I should just give a small cheat sheet. So for example, we talked about relaxing savings constraints. So for people that are familiar with the savings group model, most of the time we say if the woman saves 10,000 naira, she's only able to borrow 20,000. I know Ogun started with ×2, and I think the max is ×3. But looking at our program now, particularly maybe for old states that have mature WAGs, Akwa Ibom tested multiplying the borrowing by ×5, and it didn't really change anything in terms of attendance level, meaning that the women still remained the same. They still came to the meeting. They still borrowed and all that. So is this something that maybe in our state we want to see how we can pilot it and also test? That's an example. So you can also tell us why it resonates, because we also have learned that sometimes the women even come together to also borrow at a higher level because the group is not able to provide enough in terms of what they want to borrow, since the project says that there's a cap of ×3. So that's an example. The next one is that in your state or program or project context, what are the relevant entry points to integrate innovation, evidence-backed interventions? What entry points are missing or unclear? We talked about the socio-economic skills, and we saw a lot of interesting results. So for, let me say, NAP Scale Up, in terms of some of the trainings that maybe might be provided under the, I think the Scale Up doesn't really have a lot of trainings, but as we're developing programs or projects, are there some things that we also want to include in the curriculum? For Nigeria for Women also, do we think that, you know, for the socio-economic skills curriculum, do we already want to add it to the existing community operations manual? How do we also what are the key enablers? So do you need, so for example, when I was talking about health insurance, we had to engage the state health insurance executive secretary. We engaged with the DPRS. We talked to the NIMC. So what innovations are, okay, we want to accelerate or we want to target women affinity groups so that they also are part of the health insurance? Do we need to talk to the other programs even within the World Bank or outside the World Bank? Are there development partners or are there philanthropies that can even support this? What are the constraints? It's not only money. How do we deliver these mechanisms, and what are the partnerships which I talked about that we need to make sure that we have to be able to move this forward? Those are, last but not the least, I think this is not, yes. Last but not the least is drawing on your state or project experience. What are the realistic opportunities? What are the things that we think we can do to leverage on the existing programs or financing streams or from other sectors? How NAP Scale Up and Nigeria for Women, how do we do that handshake? We've talked about the ultra-poor graduation. We've talked about the graduation model. How do we look at NG Cares and how do we support? I know NG Cares is also doing things around livelihood and businesses. How does NIMC collaborate with the Nigeria for Women? How does Akrisal also work? They are also working with women farmers. How do we also work together? So those are some of the things that we can think through as we're working on our various tables. So, and you know, the entry points, how do we come? And I think the entry point even starts from here, this whole discussion that we're having. And I think from there we can take it up and discuss amongst ourselves. I hope I've been able to explain as much as possible how to go about the work in front of us. Thank you very much. Time. I think 40 minutes is okay. What's the time now? 20 minutes to 2. So I think 40 minutes should be okay for us to do that. So do we need people to stand up so that they can quickly move the chairs? According to, let me take you back to the slide that has. Can you help me take you back? Did I miss anything out? Okay, so you can, then please help me make sure that we have the tables joined together. One, ensuring that the summary is on each table. Facilitators, please go to your tables, and thank you very much. Looking forward to a fruitful deliberation.
Would you like to have a separate section, or you would like to join this, the state categorization? I think Access is here, Sterling is here, DBN is here. I think they can join the states. What? We can join it. Yeah, we can scatter. This is the last day. This is we can join 2 tables.
the email on the screen. Send your slide to the email on the screen. And you can just let us know when you've done that. So I believe we've all sent our slides to this email. For those without slide, that's also fine. So I'm calling on the first group to present. We'll go with, I think, South-South first. South-South, who is presenting for the group? Five minutes. Okay, so after South-South, then we follow the normal order. Federal will go first. One, I think you have one on your table. Then after Federal, I think North Central. Then we go to the next table. Northeast, then this table, Northwest, then that table over there. Southeast, then the last table there. So you have only 5 minutes to present. 5 minutes. Yes, 5 minutes to present. South-South. What do you have?
Okay, thank you so much. My name is Ofanime Etukwa, the Project Coordinator, Nigeria for Women Project, Akwa Ibom State. And I'm presenting on behalf of the South-South Zone of Nigeria. We are Akwa Ibom, Cross River, Edo State, Delta State, Bayelsa, and Rivers State. We have a common belief. We share a common problem, and so we are going to solve it. Not state-specific, because whatever we discussed is for and on behalf of the South-South Zone. So question number one, which of the innovations evidence discussed so far resonate with you, your state program or project, and why? We spoke about the Nigeria for Women project. Let me start, because charity begins at home. And also the health insurance. And we said that these two projects resonate with the South-South, because if we increase sensitization and awareness, when a woman serves and then take loans involved in business, she will be able to take care of her needs. We also said that the savings group from the Nigeria for Women project, if we marry the health insurance with it, it will help sustainability, and then the social insurance groups will provide free health, and then it will just make every woman happy. For question number two, so the innovations are combining the health insurance with the Nigeria for Women project. And then the entry points, we have His Excellency, of course, the governor of our state must be in the know. We have the wives of the governors of the state, the various ministries and the commissioners. For question number two, in your state, or let me put it in this way, in the South-South project context, what are the most practical and relevant entry points to integrate innovations and evidence-backed interventions? What entry points are missing or unclear? We talked about these appeals, and then we said that if it is included in the school curriculum, maybe from the primary education to the child will grow with the belief of socio-emotional skills. And so we try to integrate even in the secondary school curriculum. Let every child know that they need the socio-emotional skills. We talked about layering the social-emotional skills training with existing programs and building up with cooperative development. And also, we did not forget to include men. We said, in as much as we are talking about the women, in as much as we want to build the women, we should not only make the woman have the social-emotional skills and then the men are left behind. So to balance the home, because we need peace in the house, we also should integrate the men into the social-emotional skills. We also talked about the use of the data and social register to identify those to include in the works, which we talked about sensitization, that as we implement the cash transfer using the social register, we should sensitize the women that the little they get or the much they get from the cash transfer should not just be used for food. It should be used for investment. And so they should graduate from the cash transfer into the saving groups of Nigeria for Women project, and then they grew. So the entry points are the schools, the principals, the commissioners for education, the Bureau of Cooperative Development, the special advisors to the governors, and we have the civil society also. Please, question 3. Please, the next slide. Okay. In your state program or project context, what would it take to operationalize these entry points, the key enablers, constraints, delivery mechanisms, and partnership? For innovations, we were so particular about the appeals and the Nigeria for Women project, that if they come together, and also the cash transfer, that if these 3 projects should combine or merge together, it will form a very wonderful operation in the South-South zone. Okay, the key enablers, Commissioner for Education, His Excellency the Governor, all key stakeholders, the school management, the Ethical and Attitudinal Reorientation Commission, religious leaders, traditional leaders, the youths, the focal persons for the World Bank, the media, and the CSO. Constraints, bureaucracies in governance, lack of financing, lack of understanding of projects, and to simplify communications into the language the women can understand. Delivery mechanisms, we talked about the stakeholder engagement, sensitization through both print media, pictures. We talked about community dialogue sessions, seminars and symposiums, road works, outreaches, engagement, and then the women economic empowerment policies in the state, and then operating the Women Economic Empowerment Trust Funds, and also the PTAs in schools. Then the partnership, yes, the stakeholders, the federal government. We talked about the financial institutions, the MDS, and other government parastatals. Please, the last question. Okay, drawing on your state and project experience, what realistic opportunities exist to leverage existing programs or financing streams from other sectors or co-design policy approach? Realistic opportunities, we talked about including all these approaches into a gender action plan. We talked about the different state governments, His Excellency's action points, like in Akwa Ibom, we have the Arise Agenda, we have the Golden Initiative for All. In Edo State, we have the Shine Agenda. In Cross River State, we have the More Agenda, and all the agendas or the action points of His Excellencies. We said if we can key into it and include our strategic plans into those agenda, it will work. So the entry point still remains His Excellency, the Governor, the key stakeholders, the commissioners of different MDS, and the civil societies. Thank you so much. I hope I'm not taking enough of your time.
Thank you very much. So, okay. So, the federal, are you ready? Group 1. So please kindly stick to time, just 5 minutes, so that you can also take maybe questions or feedback. Who is presenting for this group? Yeah. Oh, yes. Good afternoon, House. All right. My name is Vera, and of course, I'm representing Federal. I think we deserve another round of applause. We have it. Okay, thank you. So for us to answer question 1, we're Federal. Of course, all the innovations resonated very well with us. Though we had a bit of misalignment on the cash transfers or conditional cash transfer, but we said, looking at the lens, right, from, the Honorable Minister who had demystified that, okay, it will make some of the beneficiaries complacent. We said, fine, because we also had success stories where some of the beneficiaries used the money and invested, in a project, and they earned, very well. So we said we can, still leave out still incorporate the conditional cash transfers, but it would be a way to, ease them into the poverty alleviation program. And they can also use that money as investments, to either access loans or any other assistance, from different partners. All right, so we also talked about the ripple effect of those cash transfers. So when someone has money, he can spend more. There's economic activities happening, right? So indirectly, they are reaching the community within them. So that was the condition we said we're going to live in the conditional cash transfer program. Okay, on question 2, we asked ourselves, what are the entry points? Who are the gatekeepers? Of course, we're Federal, but we still have to touch base with the gatekeepers of everywhere we want to make an intervention. And we said we'll recognize the states, the local governments, the communities. And for agric intervention programs, we can't necessarily make impact, except we're going through the agric development programs, ADPs, who have different levels of people who can administer the extension or cascade down the training down to the very, very rural grassroots. So we also said livelihood trainings. How do we impact these people? How do we enter into this community? So we said we're going to be bringing in livelihood trainings to them. We're going to be designing community operations manual to them to introduce social, emotional skills, right, and training for some of these beneficiaries. And we said we're going to be doing that for the Sway AgFin program and, of course, the Nigeria for Women project. Then it was also important to incorporate education for the female, for the young woman. Even right from primary school, we're going to ensure that these young girls get, education up until the tertiary level. And of course, data. Data is a new oil. You really cannot do anything without, knowing the people where you want to intervene. So we recognize that data-driven decisioning is a great entry point into any community you want to impact. And of course, effective stakeholders. You have to know who you are working with and know the who's, the people that are the decision makers, the influencers in those communities. So yes, those are the entry points for us. Then for question 3, who are the key enablers? The key enablers here were identified as the traditional rulers, the gatekeepers, the keepers of culture, right? And of course,
influencers, project champions, and the Nigeria Governance Forum. What are the key constraints? We have sociocultural barriers, language barriers, tolerance, right? And even data availability. Then we also talked about political will. So you might be going to intervene in the program and someone else has another political agenda, right? That would be a major constraint, for us to administer this program. Then how do we deliver these programs? We said we're going to be using data to sensitize and convince people. We would have focal group discussions. We would have town hall meetings, use of community groups, and of course use the traditional rulers in each of the communities, to influence them. Who are the partners we must work with? NGOs, MDAs, financial institutions, international development finance partners, local development finance partners, and the likes. I have 10 more seconds. Now, what is the realistic opportunity? So what we said we're going to be doing is to come up with one bundled solution, which is the SWAY ACFIN solution 2.0. We're going to be coming up with a one-stop bundle solution program, which is the SWAY ACFIN 2.0. That program will be partnering with the Nigeria for Women project, which we know already would have administered emotional training, vocational training, and every kind of training that, the participants would have. In that program, there will be health insurance, because when the people are not healthy, they can't farm, right? In that program, we will also have access to labor loans, right? We will give labor loans, and we'll give it timely. So it's going to be a digital solution that would ensure that loans are disbursed on time, right? And of course, there will be insurance to insure the biological assets, and of course, the people that are doing the farm. So the farmers can sleep well at night and know that if anything happens, they can call on the insurance company. So it's a one-stop shop, right? And even after that, there will be post-monitoring, which IO, MENA, and the World Bank Group can come, and assess the impact, for us in the federal government, and then we'll take it up a notch higher. Thank you very much.
Thank you. All right, thank you very much. So if we have any contribution, maybe reaction to the two presentations so far, please just let me know. Raise your hand. Maybe you want to counter whatever anyone has said, or you want to contribute to what they've said, or you want to support it. Ayo. 1 minute.
All right, thank you very much to the two groups. I think for me, for group one, the entry points are very clear. I think it's also very similar to group two. But group two was, the entry point was clear. But for me and for other groups, as we come forward, let's think about the realistic opportunity. That is those are the, for the two groups, especially for the first group, it is not clear. You want to do integration, you want to do SCS, you're identifying schools, enablers, you have identified commissioners and all of those things. So what is that realistic opportunity to get this done if you were to do it tomorrow? Those people can help. Yes, it is good to do these interventions. It is, now we know this entry point, but what is that realistic opportunity to get it done? For group two, we identify SWAY 2.0. It's good, but it's a concept. What is the realistic opportunity to make SWAY 2.0 a reality? That is what that means. So how can we make it a reality? Sterling have some funds already. The management is thinking about it already. The federal is also thinking about doing something similar. And we see that if both come together, this idea will work in the next 1 year, in the next 5 months. So that is the realistic opportunity. So for all of us as well, when we are coming in, if you think about, okay, these are the entry point for these interventions that we want to do, then, and that is why you see it is the last part of the whole exercise. So bring it down and now tell us all these ideas, these are the realistic opportunity to get them done in the next 1 year, in the next 30 days. Let's move from concept to reality. So these are my major.
All right, thank you. I think you should reflect on that. Those coming after should also try and take that into consideration for their presentation. So the next group is this group. I think you already have your slides so they can project it on the screen, right? Who is presenting for you? Who?
I don't know if they put it.
So you can move. He disappeared.
I don't know if they put up the slide. Good afternoon again, everyone. My name is Bountiful. I'm representing the North Central Group. Okay, so for the first question, we spoke about a few things that we could see are already working. The conditional cash transfer is something that, is some succor to the vulnerable group. And for us as a group, we're looking at this set of people to receive cash transfers as the elderly, actually senior citizens or people who are aged or have some ailment. That's the focus of our own cash conditional cash transfer. It's relevant across all the ongoing intervention. Next slide, please. From MyCrystal to Nigerian for Women program and as well as LPRES. Something else we thought that would be beneficial going forward will be capacity building and training. To say whatever we want the beneficiaries of our intervention to become a part of, we need to train them to develop those skills to better effectively manage those interventions. Still on that question, I think that's an error. Yeah. Okay, so we also introduced something called cash flow-based loans. So for beneficiaries of targeted interventions that are already doing well in their businesses and all, they do not need to bring collaterals that they don't have or this quantum of guarantees that the banks expect them to bring to securitize their loans. For us, we think that if they have good books and their statements and records can show that their cash flow is good enough to harness loans and take on these opportunities, that's enough guarantee. The cash flow of their businesses should serve as enough security for their loans. We also spoke about, still on training and capacity building, of building their social and emotional skills, in this case for women, and it's relevant across all the projects. We want to also introduce labor-targeted support for farmers. So for the NACS project, that's the Nigerian agricultural scheme, it's an input-focused scheme where they support farmers with subsidized input. We're looking to see if you assess yourself as a farmer and you're looking at your EOP, you have the input side of things, you also have the labor side. So we think this is a good opportunity to do two things: to introduce loans that will support labor. In this sense, we're looking at two types of labor, so manual labor and mechanized labor. So where we can have machines to take up the gap that humans should close and machines can efficiently do that. We're able to provide support for those farmers to access the service or to procure the equipment that they may need. All right, so for question 2, some of the entry points that we've identified as working, like for the Nigerian for Women program, the beneficiaries already need to have an income-generating activity. So they might have running businesses, be it processing businesses or farms or something of that nature. We're not just going to pick beneficiaries that do not have things, businesses or small projects going on for them. And we think that showing that seriousness, taking that individual step in the first place is enough to get them on the project. So for conditional cash transfers, we want to ensure that the social registry captures each beneficiary that is going to be a part of the program. For the NACS Agro Pockets scheme, we want to ensure better farm data capture. We want to ensure that anybody who says they're a farmer to be a part of that program or that targeted intervention needs to actually have their farm. So farm coordinates is important to be able to trace or to, how do you call it, tie a farmer to the coordinates of their farm. Okay. Just to quickly wrap up, for question 3, we have mapping of stakeholders. Who are the people we want to work with? How would this be most efficient for us to be able to deploy at field level? We also want to focus our energy on digital extension framework that allows us to cut through barriers like human errors and human decisions to be able to deploy solutions directly to farmers through mobile or USSD-based solutions. Public-private partnerships and development partnerships is also something we can leverage on to ensure that we have more cash pool or support pool for the targeted beneficiaries. Now, some of the opportunities we see in the current projects that we're implementing is, first of all, backward integration. For instance, for the Nigerian for Women project, it's mostly women who are focused on processing. The coordinator suggested that he would love to see the farmers go onto the farm to be able to reduce their cost of feedstock. So blended finance is also something that is important. Insurance for the farmers, guarantees, leveraging financial services, that pretty much the time is up, and that's all. Thank you.
The next, please come up for your presentation. I think you also shared your slide, right? Okay, so project. Your mic.
Okay, thank you very much. Good afternoon, everyone. My name still remains John Wachiku, and I'm representing for Northeast. So, question 1 for what I and my team we've put together and resolved. Which of these innovation such evidence discourse so far reasons with you, the state program or project, and why? So we have the innovation grants, all right, and that is one. We have affinity group, that's two, and we have targeted capacity building. So this targeted capacity building is for women, just the name, as the name implies, women and adolescents and women. Then we have health insurances, which we see what Ogun State is trying to put up with the trust fund. So this is something the Northeast will be trying to bring in to board to them. Then why are we doing this is it simply explains itself for multidimensional impacts and relevance to the context, you know. So this alone summarizes all for that question one. How do we do this? Okay, so question two. Why, okay, in your states, program, project, context, what are the most particular and relevant entry points to integrate innovations / evidence-backed evidence? Okay, backed intervention. What are the entry points? Obviously, a lot of people have said using the government, carrying out advocacy visits. So like we have the Yobe L Press, we have the Adamawa and Taraba entry points, Women Affinity Group, VSLE. We have ministers, livestock ministry, royal fathers and religious leaders. We have the umbrella civil society organizations, faith-based organizations, and CBOs. So these are the commonly entry points we use for every state. And Northeast, because of its peculiarity, we go from the federal, state, local government, then world. And sometimes we go as far as security, and because of the how security prone we Northeast are, we all know how we are in the Northeast. So let me go to next slide. Okay, so realistic opportunities, Northeast Development Commission, sector coordination meeting between MDAs and projects, gender representative budgets, women economic empowerment budgets, private sector and women lead NGOs. So, and the entry point for these also advocates to the office of the First Lady, the His Royal Highness, the governors, Commissioner for Health and Women's Affairs. Then we also have an advocacy visit to Honorable Commissioner, state government, advocacy to the potential partners, like the partners that we will be partnering with in the states, because most times these projects or interventions must have been carried out in the state and collaborate with them. So, that's it. Okay, so Mr. Ayo said something earlier on about the realistic reality to have a. There's another slide. No slide. No slide. Okay, so what we are doing that is bringing in the VLSA in the Northeast, basically. So that is the realistic for your question, and why we're integrating that. Thank you.
All right, thank you very much. So any comments, feedback, contribution before we move to the next presentation? Comments? Okay.
Slide. Sorry. Yes. So good afternoon, everyone. My name is Mohammed Hassan. I'm to present on behalf of Northwest Group. Part of what we discuss and resonate with the group's team is that we see it that saving alone cannot be able for the work members to get assets, and they have to be integrated with a livelihood grant for them to be able to complement what we want to achieve in the women affinity groups actually. Then the important, what we integrate the socio-economic skills training, financial literacy training, and small-scale grant to provide a starting point for them to grow. Okay. Then what it takes out to operationalize the important innovation we think about adding further skills training to saving groups members. As we find it out, the enablers is that engaging with key community leaders, religious leaders, and other groups that is gatekeepers in the community. It will help a lot to change the narratives. Then the constraint we found in the this group is that part of the experience we have in the core north, actually Northwest in particular, there is some kind of communities where women are restricted from coming out, particularly going to the market to engage into business activities. So we find out that to get a delivery mechanism for that is you have to engage in advocacy, visit to the key stakeholders, then sensitization and community work with women, particularly the husbands and other members of the community who are men, to engage with them and sensitize them on the importance of this savings and loaning. Then partnership with community leaders and LGA stakeholders too will help a lot in achieving our results. Then on the opportunities for linking existing programs and financing streams, this we discussed about it particularly in my state and the Katsina state actually. The state government has already put its commitment with regard to this in Jigawa state. The state government has given a funding of 1.09 billion to the Nigeria for Women program. And in Katsina, I know the governor has already approved and provide 4 billion into the Nigeria for Women account for sustaining of this program and maybe implementing in the other LGS within the state. Thank you very much.
Thank you. Ms. Thank you. Any comments? Okay, the next presentation then. I'll give her this one. So no slides, right?
Okay.
Have one. Yes.
Okay. Good afternoon, distinguished ladies and gentlemen. My name is Rufina Adanoma Ugoke from Ebonyi State. I'm here on the behalf of the Southeast group to present. So the first question, which of the innovation evidence discussed so far resonates with us in the Southeast? The Southeast represented here, we are Abia, Ebonyi, and Anambra. So after our group discussion, it was clear that naturally in the Southeast, there exists age grades, market women association and cooperatives of different types, which are likened to women, likened to affinity groups. Hence, formation of WAGs are not different. They are not difficult in this region. So for us, the WAG group resonates with us because these groups teaches women to save and to manage finances before going out to seek for loans from financial support systems like the commercial banks. The second one, we have programs and project contests that are most practical and relevant entry points to integrate this innovation, evidence-backed intervention, and what entry points are missing or unclear. So our own entry points, because of the predominant features we have in the Southeast, is through these women affinity groups that project themselves in form of either cooperatives, women's social groups, church groups. So they are easy entry points for us. Then the third one is our enablers, constraints, delivery mechanism, and partnership. For the innovation of the WAGs in the Southeast, we have our enablers, the key enablers. We have wife of the governors. They are like brand project champions. And you all will allude to the fact that they command they have high command of women followers. Of course, the commissioners of women affairs are there to provide support. Then constraints, we envisage none. The states have counterpart funding for keying into the WAG groups. And of course, we have independent partners, the World Bank, to provide counterparts. So delivery mechanism, it's of course the system already on ground has a multi-sectoral approach that brings together the line ministries that will enable government either to provide through the counterpart and through the budget, state budget funding, through women affairs and social development. They are part of that delivery mechanism. In fact, they are the host system to drive that. Also going to collaborate with the Ministry of Agriculture, Commerce and Industry, Health, vis-a-vis insurance, and finance, budget and planning that will also ensure that these line ministries, they collaborate and they make sure that provide light items in the state budget that will ensure that will drive this innovation forward in the states. For partnerships, we are looking forward to having different IPs that share the same views, because the World Bank is already there championing. Other IPs are also looking at joining us. In fact, the UNICEF in Ebonyi State, they are even looking out currently for an avenue of collaborating with the project to see how they can partner with the projects to ensure that women get not just that they are into agriculture, but they are healthy to produce. Other NGOs and CSOs are also willing to align. So number 4, drawing on your state project experience, what realistic opportunities exist to leverage existing programs of financing streams for other sectors or co-design policy? For here, we have the Anambra concept where there exists one youth skill empowerment program targeted at life skill training and skill training to empower women and youth in the state. We're looking at when the women are empowered, they were able to join. Then in Ebonyi State, the Ministry of Women of Economic and Economic Empowerment, there is a funding by the state government that gives out support to women groups that will ensure that they integrate into this kind of program. We also have L-Press in Ebonyi State, and the project is looking at intervention. We are looking at collaborating with L-Press because L-Press is targeted at livestock and agricultural intervention, and we intend to leverage on this to link these women groups into collectives and agricultural value chains that works for the state and for the Southeast. Thank you.
All right, thank you very much. The last group now, the last table. Yes, that's the last. We started with this group, then we moved like this. That's the last.
Good afternoon. My name is Abiodun. So I'll present for the Southwest group, and the states represented are Ogun State, Ekiti, Ondo, and Lagos State. So for the first question, talking about the interventions that have been discussed and the ones that are that resonates with us. So we actually picked 2, which is the FNLP cash transfer as well as the SWAY Agri-Finance. And for the cash transfer, first of all, we know that in Nigeria, what they say is that the rich keeps getting richer and the poor gets poorer. So this intervention actually allows the government to see the poor people in their own state, because there are lots of interventions that just go around without actually, narrowing down to the people. So what we have done is to say that, yes, this actually helps to enhance the livelihood of people, the real poor people, and it doesn't go through hands that will not eventually get to the poor, which the government are targeting. Then for the SWAY Agri-Finance, which is supporting the female farmers, we also supported that one for the reasons that Nigeria is blessed. So actually farming is done across every nation in the country, every state in the country. But yes, we know that they are more predominant in some states than the other. And this is an opportunity for them to be able to support every female farmer across the whole nation as well. Then talking about the second questions, which are the key enablers to these interventions, we saw starting from the top, which is the Ministry of Budget and Economic Planning, the local government leaders, the community leaders, the paramount rulers, especially because they can identify these people within their communities. And of course, women associations as well. Talking about constraints, for the cash transfer, we are saying what's the reliability of this register that is used, which is this social register that is used. How often is it updated? How are we really sure that it's actually the poor that gets registered and the money truly gets there? And again, talking about how often it is validated. So the register is up to date, and probably the very next day, the beneficiary on that register has passed on. If government is not regularly updating it, they will just be, making payments into the wrong account. Secondly, the intervention, the relief is actually to help people maybe move out of the poor state and begin to get empowered. How often do they check that they are still not the poorest of the poor and they have moved away from that bracket? So that's a constraint. And then the criteria for enlisting, I think we spoke about that. And then the awareness, we think is still low, across every state. Some people will even say, oh, really, has it started in your state? So it means that government still has to do a lot when it comes to awareness. And we also said that the value of the intervention probably, is small. Although we agree that it is not an empowerment, it's a relief. But at the same time, we are saying there is inflation. How well can this actually help them to survive? So, and the frequency of that intervention as well. We felt that it's a constraint. And maybe that 3 months, they might not even be able to survive it. Then we talked about the entry points, speaking to women associations. We also identified public schools, because from the schools, they are able to see these children who you would be able to identify very vividly that they are vulnerable. And you are able to trace it back home to say, okay, where are your parents? Maybe when you check, you see that truly this person needs an intervention, and then vulnerable aged women as well. Family, female-led homes as well, where the woman is actually the one bearing the responsibilities. We felt that that's another entry point to check. And then for the agri-finance key enablers also, we spoke about the state government, Farmers Association, the big corporates that will be uptakers of the produce that will be coming from these women. And we also spoke about fintechs, because we feel that to balance the supply and the demand side, if it can be digitized such that, from a dashboard or some sort, they are able to see how much is coming like it's done. But at the same time, these people can have some form of documentation that they can borrow on, because they are able to see from a dashboard. It's transparent. Everybody can see what the inputs looks like. And so we'll probably be needing the digital people, fintechs and stuff around there. And then mechanized storage facilities, because we know that a lot of produce goes into waste. And so if we can work with those ones as well. And of course, access to market is a constraint to them. Aligning the intervention, the loans, to the farming cycle, we felt that it was critical, so that at every point in time, we are not giving them monies when it's not farming season, and then they, divert and do something different. So we've talked about the inadequate processing facilities and storage. And then for the entry points, we spoke about the traditional rulers, Farmers Association, the cooperatives, and the Ministry of Agriculture as well. And finally, for the opportunities, we had said, yes, it's, the poor are everywhere. So this intervention across every state in the nation would help to, raise the livelihood of people, and especially women. Thank you.
All right, thank you very much. I think you all deserve a round of applause. We've had very good conversations, so many very important points coming out from your discussions. I don't know if you have any burning question, contribution. Please introduce yourself.
Thank you. I'm Freddie Klager. I'm with the Office of the Vice President. And I just want to make a contribution with respect to financial services. I think from the first day, the focus has been more on the issue of credit. But I think we should also be looking at opportunities that are out there, like the capital market. For women, we have opportunities in crowdfunding, where you look at technology, the use of technology now. So maybe things like that, working with fintech, we can also be able to get funding coming to the women from things like crowdfunding. Then we can also overemphasize the issue of insurance. That's one way to ensure that there's sustainability in whatever programs that are being thought of or designed. Thank you.
Comments? Please go ahead, madam.
Good afternoon or evening, everybody. Please, actually, my own contribution is with respect to, is like shifting the conversation from, what you have is women economic empowerment policy. So, but from all I have, since yesterday, it has been on agriculture and lower income sector. So I don't know if the conversation maybe can be probably, at least for the organizers, to involve high income sectors. Like for instance, actually, sorry, my name is Agina Mkechi, Federal Ministry of Works. I'm an assistant director. In Nigeria, women economic empowerment is always over-concentrated on low-income sectors. And, but for high-income sectors, there are so many areas that are still untapped. For instance, like when you look at road infrastructure, construction, housing. So these are areas that are still untapped in the sense that once you talk about women economic empowerment in Nigeria, everybody thinks of the rural area, the woman in the village, the agriculture, and all whatnot. So women may not only be beneficiaries, that is my point. They can also be professionals and contractors and the asset owners in these areas. Coming to look at that, for instance, let me use my field as an example, women engineers. There's a lot of gender gaps when it comes to the construction and rehabilitation, procurement. For another example is like an average female civil servant cannot boast of having a decent home. But the male counterparts, it's very easy for them. I don't know how they do it. But if there can be interventions, probably maybe some, like, having a higher percentage of women engaged in projects and all these housing schemes, giving them dedicated funds and stuff like that. It can also help. Or having all these groups being, I don't know how you do it, but I think the discussion can also be, moved to high income earners, not only low income. Because empowerment, that is being a policy for women economic empowerment, it should, involve both. So that's just my point. So
yes,
World Bank will know how they will do it.
Yes, we are already doing it. Thank you for the two comments. I think Ayo will respond to those comments. Those are very important comments. Alternative financial options for women and also in terms of crossover for women.
All right, thank you very much. I think those are great comments, and thank you so much to the group as well. Yeah, for sure. Just to respond to these two questions, in terms of alternative finance, just to let you know, in one of our programs at the bank, The field included, somebody mentioned it, Ayo from DBM mentioned it yesterday. That's part of the things we are exploring with them, particularly equity finance. I think it's part of what you wanted to talk about as well. So we're looking at how we can make equity finance work for SMEs, especially for women as well, in addition to the normal credits and other products. So for sure, these are part of the things that we are creating learning from to know if it works and how it works and how we can make it work for women. So thank you very much. To your work, I would like to point you to our website. I think we have some stuff already that are pointing us to our website, our policy briefs. We have a whole, I would say, couple of analytical pieces on occupational segregation, how to move women to high-earning sector, right? That's I think, if you get to our website, you'll see a couple of that. But one thing that is very instructive or that is very fundamental about this is it is foundational. It is from girls getting involved in STEM, right? It is very foundational. And we started with Ogun State. I think my Ogun State people are here at some point to do something on TVET for girls, scholarship TVET for girls, to see how we can use scholarship to promote girls' participation in STEM courses, which can help them to get involved in this high-earning sector. But that didn't work. But we are still very much open to explore other opportunities to get to understand proven interventions that can help to break the silos in terms of occupation segregations between men and women, and to help women to move into this high-earning, male-dominated sector. That's the way usually we call it. So, but if you have something in the ministry thinking along this way, please call on us. On the procurement side of things that you mentioned, we've also tried to do something along that side, but we have not been successful. But like we have said, and Mike will also highlight on some of these things, especially some of the work that we have ongoing and that we are about to commission. You will see that all of these are on our table. We are looking at how we can help to address some of these things. But we will continue with your partnership, with your support to help all of us to get to this concrete evidence, these concrete innovations that can help us reduce this inequality, right? Especially economic inequality in our society. Thank you very much to those great questions. Okay, let me stop here. I'm not rounding up.
Thank you so much.
Thank you. Please, a round of applause for all of you. You know why you're clapping for yourselves? Very engaged. Your contributions, they've been very rich and very insightful. So we've had a wonderful 2 days, isn't it? That your yes is a tired yes. It's like, let's get out of here, let's get out of here. But we'll be getting out of here soon. And let me invite back Michael as he takes us through the summary and the key takeaways of what we've been doing here for the past 2 days. Over to you.
Thank you so much. Thank you, Nancy. Please, let's give a round of applause for Nancy. Excellent moderation. All right, we're at the end here, but it's also the beginning of this remarkable 2 days. You know, when we opened, we talked about learning and acting, and you know, these policy clinics were kind of a great manifestation of the action that's coming forward. And I think, you know, I just want to reflect on a few quick takeaways and thank the many people who made this event happen. You know, first, a phrase that will stay with me. I know Kende mentioned it as well when we heard the Minister of Humanitarian Affairs this morning say, when women succeed, Nigeria succeeds. And it's a simple sentence, but I think it captures what what we're trying to do here and the case for what we've been discussing over the last couple of days. And I think the findings that we've heard today make that case concrete. Sustained gains for women 3 years after a program ended, reductions in IPV from a short household intervention, cost-effective skills packages that lead to outsized returns for women workers and entrepreneurs. I think that's something that really, it's exciting to learn about, and it's really even more exciting to see it being embedded in program design going forward. Second, I think we've learned a lot, but we still have a lot more to learn. When Nancy, you opened this forum asking how an economy can walk on one leg, and the answer, of course, that it cannot. You can get so far, but not, and only so far. But the bigger question is what to do about it, right? So, on this, the forum has shared a lot of this frontier evidence from these amazing programs at scale, from Nigeria for Women, the NASP program, Appeals, YESO, and just as importantly, from private sector partners, Access Bank, Sterling Bank, and the like, and from NGOs as well. And I think, what struck me, though, when listening to these remarks is how many questions still remain open. How capital flows within a household and actually women can retain control over that capital, or, of course, how it can be empowering, or questions around digital technologies and their links to women's empowerment. There's a lot of open questions that I think still really need to be addressed, but really as embedded within this third piece, which is scale. And I think one thing, a third takeaway I have from this is that scale is a process more than an event per se. Throughout the last couple of days, we've been hearing about how scale is really it's not about replication, it's about learning, iteration, and experimentation repeated over time. You heard this from Mahesh talking about NASP. We heard it from Yetunde talking about health insurance, from the minister about the one humanitarian, one poverty response system reform. And I think this is, of course, not a straight line from pilot to national program. There's a lot of monitoring, adaptation, contextual fit, coordination among stakeholders that's needed. And I think that's really where the next 5 years or the next coming years will really be focused. And finally, I think in terms of what this forum represents, I described how we're trying to build the rigorous evidence with Nigerian policymakers in Nigeria. And what I've seen is really the other half of that equation. So Nigerian policymakers, practitioners, private sector actors, taking that evidence seriously, interrogating it, working out how to use it, how to apply it in their daily work. So this is really just what was so inspiring and encouraging about these policy clinics that we just heard. And it gives me a lot of confidence that the commitments, the ideas, the plans going forward will actually be carried forth beyond this room. And so before closing, I do want to thank a number of distinguished speakers, panelists, presenters, honorable ministers of budget and economic planning, women affairs and humanitarian affairs, our colleagues who traveled from across Nigeria, from other countries around the globe, to share their evidence, their ideas, their perspectives. I also want to acknowledge the 15 commissioners that we have from 15 states across Nigeria. It's really a remarkable showing. Thanking our partners in research, the National Directorate of Employment for YESO, the Ministry of Humanitarian Affairs, and particularly the NASP coordination unit, Appeals, and the Ministry of Agriculture, Taraba State Government, Development Bank of Nigeria, many representatives from the Nigeria for Women Project, and of course the Ministry of Women Affairs, LPRES, Acrosol Project, Sterling Bank, Access Bank, the Nigeria Governors Forum Gender Secretariat, Pro Health International. Also want to thank our survey partners who are here, a number of them in this room, IPA, Hanovia Limited, Oxford Policy Management, and of course the entire team at WOW Connect who actually made this magic happen, Toby, Adenike, George, and many others. Almost done, but I have to acknowledge the many World Bank colleagues who put this event together. Maria, Pochi, Khadijat, Neka, Ayodele, Yetunde, Michael, Mahesh, Julia, Amy, and many more, and Nelsie, of course. And special thank also to our donor partners who really helped make this event happen, but also helped actually, more importantly, forge these partnerships and bring forth this evidence and the work. So that includes the Gates Foundation, FCDO, NORAD, and many others through the Umbrella Facility for Gender Equality and the Think Africa Partnership. Thank you all so much for the energy, the rigor, and honesty you brought to this forum, and I really look forward to seeing what you'll do going forward. Thanks very much.
Is there any other thing for me to say, since Michael has already said it all? But I just do know that for the past 2 days, we've done something very important. We've tried to align evidence, we've tried to align policy, women issues, and most importantly, even leadership, because we've heard in the last 2 days from leadership, those who designed the policy. At least what I can take away as a journalist, because even though I'm the MC or the anchor, underground, or perhaps it's even glaring, I'm still the journalist. I can take a lot of things away from the past 2 days, coming from the humanitarian minister, that I think he heard what you all said. So they may tweak a few things. They may begin to perhaps redesign some of the things they didn't think about. So at least that is one thing that I have to take away. And also from other ministers, how they spoke yesterday, that the issues of women are, up on their chest. But the thing which we need to do, or which we need to begin to see, is what I said earlier. If we know what to do, we have the ideas of what to do, we should now act faster. So the responsibility is now very clear. We are leaving perhaps more committed and more committed to act. It's been so nice doing this with you for the past 2 days. Thank you very much. I remain Nancy Naji. I'll be going back to my day job tomorrow. So watch my program 11 a.m. to 12 noon tomorrow. For those of you that have not watched before, that is my 24/7 job. But it's been nice doing this with you. So we'll see again next time. Lunch is served, and the ushers will be taking you table by table. Thank you all. It's been a pleasure.